We heard from Chris Hazen, he will not be making it today. We expect Don maybe showing up a little bit late. There's been some parking difficulties here. So is Metro TV good to go?
Yes, they are.
Excellent. So let's go ahead. I'll call the meeting of the Lane County Budget Committee for May 10th to order. And the first item that we have is committee business. Ms. Moody, do we have anything from staff?
Only that, as you all see, we're holding our first hybrid meeting. So we have people on a Zoom meeting and you're here in person, obviously. So we'll see how this technology goes. But a huge thank you to Tanya Ellis in the budget office for working with Metro to figure this out for us today. And then I just want to remind everyone about the microphones on the table. So it seems that last time maybe there was some covering of microphones accidentally with binders or papers too close to them. So you might just want to be careful with those. And they do pick up everything, including whispering when you're on air. So just reminders there. Thank you.
No whispering.
Excellent. Along with that, Bruce, please do not be shy. If I miss you on screen and you have a question, please speak up.
Okay, will do. Thank you.
Thank you. Okay, any other committee business from committee members?
Can I just say one thing? Steve Manella is here. And my first meeting in this room was in 1995, and Steve Manella was sitting in here with hair out of here.
How far, Pat?
Okay, let's go ahead and move forward. We're doing Health and Human Services first today. Eve, I see you online. Are you ready to go?
I am. Thank you so much. I really appreciate you all supporting remote participation today. I did not want to share with you all what my daughter shared with me from kindergarten. So, okay, go ahead and advance the next slide. We are covering everything today that I didn't cover with you last week, which is almost the entire Department of Health and Human Services. Of course, this year, we will not have specific presentations from admin, clinical financial services, or quality and compliance. But we do have folks in the room who have awareness of those divisions. If any questions about those areas come up, go ahead and advance to the next slide. For the budget details for these portions of our department, our state and federal revenue, 67%, fees and charges, 14%. That's largely related to our billable areas that are providing billable services. General fund is just over $7 million. We do believe that 401,000 of this will be one time. And we have some specific areas of increase in HSD and the housing division, which we'll speak to when we talk a little bit about the challenges that we've had in administrative fee caps related to the grants that we've been receiving. And then Veterans Services, which is actually returning to the funding that used to be from the general fund. And then it had decreased due to some grants that they received. Now it's going back up. And the other area that's increasing is WIC. And that is because of a decrease in volume. We can speak to that as well in terms of the work that we are doing to bring clients back on so that we won't rely on those additional funds next year. Go ahead and move to the next slide. Our operating budget is decreasing, of course, as would be expected with our one-time funds beginning to dwindle. Personnel is 56% of the total, and M&S is 44%, though that is an average across all of the divisions and varies widely between divisions in terms of the percentages and makeup of personnel versus M&S. And next slide. Okay, now I will turn it over to Lisa Nichols, who is our division manager currently for the community health centers.
Thank you, Eve, and good afternoon, Chair and Budget Committee. The mission of the CHC is to improve the health and wellness of our community through access to affordable and holistic health care. This is accomplished via the listed services on the screen. Hopefully all goes to you, but it's quite encompassing. The Community Health Center's operating budget is $42 million, which is an increase of 3% or $1.1 million from current year. CHC has budgeted $2 million in contingency for fiscal year 22-23. In fiscal year 22-23, program revenues are projected to trend upward with a 5% increase. These increases are the result of negotiated contracts with major payers and access for new patients. The CHC has resumed school-based services, and we have begun to see program volumes increase, although not quite yet to pre-pandemic levels. Next slide, please. The CHC has experienced numerous staffing challenges and are thus focusing efforts on recruitment and retention. The CHC, as with healthcare organizations across our nation, are faced with shortages for providers, nurses, and medical support staff. The marketplace for these positions is extremely competitive, which has impacted both our recruitment and our retention efforts. The CHC, along with HNHS and county leadership, are collaborating and problem solving in this arena. The CHC has also experienced higher than normal vacancies in its leadership positions. As the interim manager here for you today. To combat this trend, CHC has worked to reorganize requirements for some of these positions. A great example is expanding and highlighting minimum requirements for our supervisor positions to better allow individuals with varied experience, education, and licensure. This has resulted in the filling of all our site supervisor positions. They're coming on board now, and we've also filled our medical director and chief operating officer positions. For service changes in 22-23, we are excited to have movement in the opening of the new South Lane Clinic in Cottage Grove. This project has experienced some delays due to COVID, but even during these delays, we continued our efforts on planning, fundraising, and design. So phase 1, which includes medical, integrated behavioral health, and alternative medicine, is scheduled to begin construction in August of this year, with services to begin in spring of 2023. Next slide, please. Imperative to the work at the CHC and meeting the health needs of our community is the usage of data and related tools. The CHC is dedicated to monitoring service provision, patient outcomes, and CCO metrics via a variety of clinical and operational dashboards. Based upon this data, we implement quality improvement initiatives to ensure we are serving our community in the best manner possible. In the past year, in fact, the CHC has added additional QI resources and staffing to support these efforts. Also integral to the work of the CHC is our electronic health record, or EHR platform. Over the last several months, we've launched efforts to review our platform and potentially look at moving to a new EHR. This decision was based upon a number of factors, including input from our staff, as well as many others. Our goals with this transition are many and include supporting our staff needs, ensuring efficiencies, capturing of important patient data, and having a system that allows our patients to be active in their own healthcare, such as through a robust patient portal. The community health centers have identified several strategic initiatives to evaluate for fiscal year 22-23 to determine what is feasible, financially sustainable, and has the greatest impacts on improved health outcomes and patient care. Suggestions received from staff, providers, and our council members who represent both consumers and community members include implementation of mobile services, expanded dental, and diverse specialty care. These opportunities will be explored in greater detail with division and department leadership, and of course, input from our staff and patients. Thank you for your time. I'd now like to introduce Carla Tasman with Developmental Disability Services.
Okay, thank you. All right, good afternoon, committee and budget chair. I really appreciate the opportunity to speak to you today about developmental disability services. So on this slide, it's really an overview of our division. You'll see the mission as well as the core services that are provided by the division. There's also a picture there of somebody who is in services. The main services include intake and eligibility services for all people who are seeking applications to receive such services. We also conduct investigations of individuals in services where there are concerns of abuse and neglect. And the largest number of staff in the division provide case management services. Currently providing case management services to over 3,000 individuals, includes children and adults. So we provide services from the point in which somebody's determined eligible, which could be shortly after birth, all the way through death for most individuals. And the services are really focused on supporting people's self-directed goals and helping to support their health and well-being and ensure their medical needs are met, and also help support integration in the community. Let's see, we also provide facilitation for certification, licensing, and employment support for people who are providing direct services. So people come to us to, for example, complete paperwork and go through the process to have their homes inspected to become foster providers, or complete the requirements to become personal support workers. All of the funding for the division is through state revenues. There is not a general fund requested in this budget. Next slide, please. And slide 2, this depicts the changes that are occurring within the division. As of yesterday, I'm happy to report we are in a new building. It was quite an experience. Been a little bit chaotic this week, but we finally got all the stuff moved in at about 6:30 last night, and people are able to come and see us in the new building. It's really been a great opportunity. Not only due to the need in terms of space, but this building is really offering the opportunity to be co-located on the same campus as Lane County Behavioral Health and Youth Services. And we serve a lot of the same clients. And so the location is wonderful in that regard for coordination of care. And in addition, it's much more accessible. Of course, before we were in the basement of the PSB, and that wasn't the best for the clients in our services. And so we're much more visible. And I think it's also a symbol of people and the value that the county has for these individuals who are in our services to have a building and a place of their own. So thank you for all the support for that. That's really awesome. So over the years, we have grown significantly. That chart there is a depiction of the last 5 years of service clients who've received services, as well as a projection for future years. And you can see there's been just steady growth. This started around soon after 2013, when there was an expansion of in-home supports. And prior to that, most of the supports had been provided in either sort of institutional or residential settings. But after 2013, there was a grand expansion of supports available for people in their own homes. And that's where we've seen the greatest growth. The good news in terms of the demand is we've also been able to add staff over the years. And so fortunately, state funding has increased significantly, which has allowed for additional staff, and we've grown quite significantly. And in this budget request, there is a request for 15 additional FTE, a supervisor, an admin position, and then 13 developmental disability specialists, the majority of whom are case managers, to provide those direct supports, case management supports to ensure people receive direct supports. The costs, of course, would be covered by state revenues. And I believe, one other piece is the growth of services, the growth in the number of individuals. It was that expansion of services, but it's also the fact that people stay in services for the most part through the lifespan. So people aren't leaving each year, they're staying, and we're adding more and more people, and that's really what's leading to the growth in large part as well. Next slide, please. So on this slide, you'll find some of our key initiatives, and there on the left is the box that says customer satisfaction. You can't really see that chart rate above it, but those are the results of our most recent customer satisfaction survey. We're really looking for opportunities to have consumer voice in how we're doing the work and listening to ways to improve. One of the things we did that we were pretty proud of, our division, was taking the customer survey that we had been using, and our DDS, our division equity committee, applied the service equity, or excuse me, the DDS Lane County, the Lane County equity lens to the DDS survey, and made some changes and really streamlined it, made it much more, I think, consumer friendly in terms of language, and we had a much better response rate this last time. So that was great. And we're in the process now of looking at that feedback and what changes we may want to make as a result.
A quick question, is that a scale of 4 then? Yes. Wow.
Yeah, 1 to 4. Yes. Service equity is the next box. This year is the first year that the state has required that we complete a service equity assessment, and then next year we'll be developing a service equity plan. So really looking at how are we providing services? Is it with an equity focus? Are we reaching the communities that we need to reach? Is there broad representation of people served? And so we are right now in the process of completing that equity survey. We're working with a consultant who has expertise in this area. And the exciting part of this as well is just we have a team of staff who are awesome and are just so engaged and really focused on this work. And this has been a really great experience, and looking forward to the outcome, and then of course the equity plan next fiscal year. And then there on the bottom you see service access, and next to that is a chart that is around the eligibility guide, or excuse me, our eligibility timelines. So we have received feedback in the past from our advisory committee that we could do better in the area of how quickly people are able to access services. A lot of the challenges are we are waiting on other agencies for paperwork, or we're waiting on psychological evaluations, for example, but we also know there's ways that we can do better as well. And so we have really been looking at service access and how do we support that. And we have broadened, of course, the number of staff in the eligibility team. We've also started doing more outreach. And we recently did a survey through our service equity process to look at eligibility and what could be helpful there. And so that is a big focus, as well as looking how we can do better in terms of timeliness into services. And then the last box is client contacts. And that just really represents how we're measuring much of our performance. Really, how often and in what settings and in what ways are we interacting with clients. The last couple of years, of course, with COVID, it was mainly by phone and by virtual technology, which created some opportunities, but also at times some challenges. And I think did impact some of our ability to connect with clients, because that didn't work for everybody. So we're really looking at now in this world opening back up again, being able to have more in-person contact, and looking at that as a means for measuring our performance. And so those last two pictures there, a couple of clients, and then in the middle is our new building. So thank you very much.
Commissioner Burney, a question?
Yeah, thanks. I actually had two. One was for the last presenter, but she needs to get some water. No, go ahead.
Sorry.
It seems like the number of, you call it customer clients
Usually, yeah.
That's a quantity number. How does that measure the quality of the interaction?
I wouldn't say that we have a good means of measuring the quality other than through probably the customer satisfaction surveys, which really talk about whether or not people are being heard and felt respected.
Thank you. On an earlier slide, you mentioned you were requesting 15 slots. Since they're all state supported, I doubt anyone's going to say no. But you said one was a something, and 13 were developmental specialists, and the majority of those were caseworkers. Mm-hmm. Specifically, how many of those are caseworkers?
We're still trying to figure out the final numbers and see where we go over the next couple of months, but probably between 12 around there. And then of course, we're going to look at adding into eligibility and potentially into foster licensing as well. So they're all direct.
They all are caseworkers.
Yeah, it's just that they have different specialties.
Well, thank you. To your last question, thank you. That was really fast. When you were talking about, we were talking about, like, there are sites where healthcare is delivered in our community health centers. Some of those through COVID have moved into telehealth. We've talked about electronic records. What I didn't hear, and I'm learning, is a real booming field that extends reach at less cost, is digital. And I'm just wondering what either our community health centers or even the larger thing, what the county is. Are we looking at partnering and involving ourselves in digital health as part of the portfolio of how we assist people? For example, I have diabetes, and on this phone, I have a Dexcom, and I can look at any point and I'll see exactly what my blood sugar is. I understand digial health can relate to physical as well as behavioral health. Just curious if that's a part of what's going on.
Yes, and I appreciate the example. That's an excellent one, with being able to use your phone. I mentioned the transition of the electronic health record, and that will be in the realm of that upgrade. The health record that we currently have It does have a patient portal with it, but it is not very robust. And so really wanting to be able to engage patients with their health through the portal, via also using different apps and having those apps talk to our health record so our staff can monitor different things or send messages. That will be part of that work as we move on to a new electronic health record platform. It's going to be in that realm of planning.
And that is digital, right? So,
yes.
So the answer is you are looking at it. Got it. Thank
yes,
you.
Yes. Thank you.
Thanks, Jim.
So just quickly, I want to go ahead and introduce Steve Manella from the Human Services Division.
Pat, did you have a quick question?
It is a very quick question. The increase in staff
Yes.
is due to an increase in clientele.
Yes.
And the increase in clientele is due to an increase in space available. That's
Yes.
all we were waiting for, right? Well, I'm glad to give up my armory where I was Charlie Company Commander to you. So,
Well, thank you. And it is beautiful, and I'm excited for the grand opening and for you to see it now.
Good afternoon, Budget Committee. I'm Steve Manella. I'm the retired Human Services Division Manager. I guess I'm
Doesn't look like it.
Retired. Or does it look like
So the Human Services Division provides access to programs that fulfill our residents' immediate basic needs while delivering the skills, tools, and opportunities they require to establish economic security for themselves and their families. The Human Services Division is very diverse. We have several sections in the division. It includes the Housing and Human Services, which Housing and Human Services is responsible for our homeless continuum of care, for emergency shelter in the community, for transitional housing, homeless diversion and prevention, and our partnership with Homes for Good and others on permanent supportive housing. And then a slew of anti-poverty services for people who are housed, who are impoverished in our community. Additionally, we have utility and rental assistance programs. Our utility assistance programs now include water and electric. We have crisis repairs for people who have heating systems that are failing. And then weatherization services, which we partner with Homes for Good on. Our workforce services include job search assistance, career guidance, work experience on the job training, and then also training scholarships to Lane Community College and other training institutes. Veteran Services assists veterans, their spouses, and survivors in obtaining VA benefits. And also our Veteran Services Program provides case management to veterans who are participating in the Veterans Treatment Court. Additionally, we have a coordinated care program. It's known as Dovetail, and it provides community health worker assistance to people who are involved in our clinical services, providing social supports to them. A lot of success in clinic is not only the medical interventions that people have, but also their ability to be housed, clothed, and to stay warm. We also are responsible for regional human services planning and for the Human Services Management Information System. Next slide. So our division budget is sort of been on a, I wouldn't call it a roller coaster, but it's an interesting time because we have grown from a $18 to $20 million budget to this current fiscal year having a budget of about $85 million. So we've seen significant increases with the emergency federal money in the COVID response. So you'll see in the budget that our agency payments to nonprofit organizations are going to decline from 60 million to 30 million. We have a decrease in temporary positions of 3.4 FTE. We are going to be phasing out our COVID motel services. We've had 118 units for folks with critical health conditions and the elderly. And additionally, we've had services for wildfire folks. So those changes are going on. We're going to be moving some of the people who are suffering from health conditions into the Bob, which is the facility that we purchased for wildfire survivors. As we have openings, as the wildfire survivors are getting housed in the community. We're very excited about this next one. We're going to be opening this summer the Navigation Center and 75-bed shelter. And this fiscal year, it's totally paid with funding, $1 million in ARPA funding from the city of Eugene, and then another $1.1 million that's coming from the state of Oregon. Additionally, we have an opportunity to get behavioral health services that will be funded by OHA.
Commissioner Trigger, you have a question?
Yeah, before you get too far off of the motel shelter capacity, of those 118 units, when you say some are moving into the Bob, so none of them include those units? Or how many of the 118? Because that's our only motel units that are longer term permanent, hours to place folks in. Are they vouchers in community?
Yeah, so we're going to be moving. About 25 individuals to the Bob, and then we have a 3-month contract in the beginning of the fiscal year for approximately 50 of the individuals in continuation motels, and we'll be working on supporting people in the community transition to the community.
So all of those, when you talk about motel shelter, we're talking about a voucher program basically, and their dispersed placement.
Yes.
Right. Okay. Thanks.
And next slide. So our initiatives, our key initiatives this year is that we're moving from the COVID rental assistance program to a state-funded eviction prevention program. In our utility assistance program, we are moving to a federal water assistance program. Our workforce services are expanding with the governor's workforce initiative, which will provide additional training opportunities to people in the community. And then in the homeless area, we are looking at expanding our homeless outreach and fully implementing it throughout the county. As I mentioned before, we're going to be tapering down our homeless prevention opportunities, and then we'll be recalibrating our coordinated entry service through a coordinated call center. Questions? And it's my pleasure to introduce Dr. Jocelyn Warren, Public Health.
Thank you, Chair and members of the committee. I am very happy to talk about public health still. So I am, as many people are now familiar with public health programs, particularly those that are around surveillance and control of communicable disease. But of course, public health is much larger than that. We also do, well, one of the other things that we're well known for, of course, is STI or STD clinics and control. So that is also, and will continue always, I believe, to be a major focus of our work. But in addition to that, we also do community health assessment and planning in collaboration through the community health assessment, which is done by the Live Healthy Lane Coalition and the Community Health Improvement Plan. So that's a great community collaborative effort. We also obviously provide policy, health policy support for the Board of Health. We have an emergency preparedness program that works in collaboration with our county emergency management group as well, but those do remain kind of separate programs between public health and emergency management.
We have an environmental health program that does inspections of all food, pool, lodging systems and some small water systems in our community. Vital records, the nurse home visiting programs for new parents in our community, which will be expanded, which I'll talk about in just a minute. We also have WIC, and then of course the disease surveillance and STI programs that I mentioned. Our FTE right now is estimated going forward at almost 148, with a budget of about 26.5 million, which represents a very big change from where we started. That is partly because we've received so much COVID funding, and we still have some of that to carry forward, some extra help and temp positions, but it also reflects a significant investment in public health modernization by the state legislature. And that, just kind of in a nutshell, is bringing public health into the 21st century by implementing the foundational model of public health, which is actually a nationwide project and in different stages in different places in the country. Next slide, please. So the most significant changes for the next fiscal year is public health is really focusing very directly on eliminating health inequities in our community. Something that became very clear to us in the pandemic, and I think everyone is familiar with this, is that those existing health inequities were not only illuminated, but exacerbated by COVID-19. And that really needs to be the focus of our COVID-19 recovery going forward. And we have a few strategies through which we hope to accomplish that. The Community Partnerships Program is a new program that is also being funded in part by our modernization funding too. And this is really to extend and grow the great work that's been done in communities with community-based organizations and working very collaboratively with those organizations and in specific communities to make sure that the services we provide are really answering the need of those communities. We're also going to be working on the climate resilience planning, and there will be some overlap here because they'll partner as well when we're doing the community outreach. The Community Partnerships Program will work very closely with the Community Resiliency Planning Group, which of course will also partner very closely with our own county program. There's a lot of places that we need to ensure alignment. I mean, equity and the climate work, I think, are two really big pieces of that. Another one is the mobile outreach services. As Lisa mentioned, the community health centers are also planning to launch mobile health services. That's primarily around primary care, which is great. There are a number of other organizations in town also that are recognizing the value of taking those services to people where they live as a way to reduce barriers. We will be doing something similar, but for public health services. So we're starting with WIC, and if you happen to be in Florence for the Rhody Festival, we will be parked in the Safeway parking lot, and we have a beautiful new mobile clinic that we were able to purchase with our COVID funding that we needed to use by the end of last year, and it was going to expire. So this was one of the ways that we could really use that funding in a way that really extended our services. Mostly public health infrastructure is people. It's hard to use one-time funding that comes to public health because what we need are the people to actually deliver the services. But in this case, I think this mobile clinic is going to be a huge advantage. So it's kind of a soft launch with WIC because it doesn't really involve clinical services. So we can kind of iron out all the details of what it takes to get a mobile clinic on the road and all the way to Florence, which will be really interesting. So I hope if anybody's there, I don't think you'll be able to miss it. So hopefully you'll be able to see it. The other piece that's really exciting for us, I think, is health communications. Part of modernization funding is funding those capacities in public health that allow us to deliver programs well. We have had very siloed funding in terms of actual programs. So you get very specific funding for tobacco prevention, for tuberculosis treatment, et cetera. That's how it's been in the past. It continues that way in some level, but the goal of modernization is to shift that, to be able to also really pay attention to those things that allow us to be successful across programmatic areas. So things like communications for me is a big one, because as I think we've seen in the pandemic, communications is really central to a successful public health intervention. But there's also policy and planning. Health equity is a foundational capability. Assessment and epidemiology also. Leadership, organizational competencies involve fiscal responsibility and presenting data in ways that are accessible to the community. So all of those pieces are things that are now just beginning to be funded directly, and we're not having to peel off little pieces of, say, tobacco funding to have one little communication thing that's around tobacco prevention. Instead, we can really do some coordinated and really intentional campaigns that reinforce all of the work across public health. So coming in 2023, we also have the launching of the Family Connects program. This has been adopted by the state as it's actually an equity initiative as well. It's intended to offer the Durham model of home visiting. It's a light touch model. It only involves 2 to 3 home visits, but with a nurse, offered to everyone with a new baby in the county to help. I mean, there's a lot of different pieces of it. It's a welcome. It also helps to destigmatize other types of home visiting, which is really important, and connect families to those programs when they need them. So part of that, and it's an evidence-based program, and part of that evidence-based relies on the ability of this program to be able to refer to other more intensive evidence-based programs, such as nurse-family partnerships, which we also continue. And we also have the largest nurse-family partnership program in the state. And so we will do planning between July and December of this year, and then hope to launch in early 2023, which is really exciting to think about, and what a kind of a different approach to parenting that creates in our community as well, that everybody is invited. I mean, I think any parent can see the value of being offered a nurse to come to your home right after you bring home a new baby. It's really exciting. We continue to align our COVID emergency response with changing circumstances. We actually, Monday was a huge milestone, which I probably should have been shouting from the rooftops, but we closed our incident command. So I am no longer the incident commander because there is no incident. So you can all go home, it's all good. Rest assured, I did let Steve Adams know, which would have been a really great thing to do. However, it just means that this work becomes absorbed back into our regular public health response efforts. So we have an expanded CD team, so that's good because we have that additional capacity that is actually brought to us by Modernization, not simply the COVID funding, so we can continue the work of those folks forward, and that this is really the community facing work, so that we continue vaccination in places where we need it. We still do home visits for vaccination for people that can't otherwise access it. Testing in communities where testing is low. It's a lot of outreach and education with our community-based organizations as well. We will continue to do that probably forever. And we continue to stabilize workforce, fill vacancies and training. The staff turnover has been, has hit public health as hard as anybody else, I think. Constantly doing trainings. We had a lot of limitations around the way we could hire into the response, so that we were dealing with turnover, every week and training new people all the time. And we're hoping to maybe consider some other ways of staffing an emergency response that are not such a big drag on HR resources as well. So that work continues, working with Eve on that. And then we're also securing office space for growing workforce. Unfortunately, Carla's building is already full. So we're just trying to find some office space downtown, which is actually not too hard to find at this point. There's a lot of places that are leaving downtown and dispersing workforce either through telework or other things, but office space is generally a lot easier to find now, which is good because we don't need a lot, we need some. Next slide, please. So our key initiatives, eliminating health inequities is the primary one. So we are really organizing all of our activities with that in mind, and how that changes our strategic planning too, which we are also in the middle of following the county strategic planning. Public health modernization implementation continues, and we go to the legislature in the next legislative session for the biennium to talk more about public health modernization. They made a significant investment in the last round, and a lot of that was because COVID really highlighted the need to invest in public health. So we look to continue that. Community-based prevention, integrating our planning more in with the kind of the work that we're doing in the community with the community partnerships program, and inviting more community-based organizations to participate in these efforts. I think it's going to be a really exciting opportunity as we kind of move out of the COVID response, and those studios are interested in doing more than just COVID. And then of course the nurse home visiting program, and really kind of building up that with the addition of our new home visiting program. And that concludes my presentation. Any questions?
Commissioner.
I have some questions and concerns about the WIC. I mean, I understand it's partly the funding model and the Fed reimbursement and so on that's making it harder to deliver the services to meet the need.
Yes, thank you.
However, what are we doing about that? Because I'm hearing all these things that I love around, you know, I love the universal home visiting nurses. That's fantastic. Eliminating health equities. I'm seeing all these pieces that are interconnected with the services that we already have through the WIC program. So I'm wondering two questions about that, if you know, sort of data points. One is whether anyone's ever done a study on, I mean, aside from the programmatic side and why it matters in human health, is the economic impact of a reduced WIC program in a community, because we know, you know, like SNAP dollars are part of a grocer's bottom line, and so are those WIC vouchers. It has impacts beyond just the immediate public health service. And the other is the real people numbers. You know, how many clients are enrolled in WIC now, and what those real numbers are of how many fewer families will have access to that program with this funding challenge, and what the criteria for denial of service is, how we decide who does and doesn't get to enroll in the program if the federal allocation isn't sufficient to meet the community need.
I think anyone that is eligible for WIC services, we could absolutely serve. So the issue about, we do have reduced funding, and actually that's true across the state. We saw a decline in WIC utilization during the pandemic. So the way that WIC is financed is that you are you're financed at the level of which you reach the percentage of people who are eligible for that service. And typically we are in the kind of low to mid 90%. And that has dropped to under 90% now. And so when there is a sort of significant drop, then they also reduce the funding, because you're not providing services to as many people. And I understand why that happens. And it's been a big discussion at the state too, of course, because it does impact people's ability to retain staff. I don't think it's as much of an issue, I think, in Lane County as it would impact a smaller county more dramatically, because we can absorb more. I think we have the better capacity to flex those services. And one of the reasons why we haven't seen a lot of WIC families is because we didn't have the in-person services, and that really does make a difference. I think there's also, from what we understand, and this is really anecdotal, is that some families believe that if they get services and somebody else isn't getting services, so they don't want to take services they don't need. And with the additional funding that came to some families during the COVID pandemic, some people felt like, well, I don't really need WIC, so I shouldn't access it, or we'll leave it for somebody else. So part of our job is to make sure that people understand that WIC is for them, and that they don't, they shouldn't look at it maybe from that lens, because the fewer people that access WIC, then the less resources we have to provide WIC as well. I do think that the universal home visiting, and this will take a little time, but that will help improve our WIC numbers as well, because the part of that work will be connecting people with the services. And then also things like going out to the Roadie Festival, with our new mobile services. I think that will be also extremely helpful. We continue to hear from some of our more outlying communities from the Eugene Springfield area that public health isn't there. And of course we are, we're in every community doing environmental health, doing nurse home visiting with WIC services. But the perception of that is, continues. And part of it is that we used to have satellite offices around Lane County. That's been a long time, but the folks in Florence remember that very well. So I think it's important for us too to be able to actually be physically there, so that mobile unit will help us a lot. And there's not just one mobile unit. We have a mobile clinic, but there were two other vehicles that came to public health that were given to us by RideSource when they were decommissioning some vehicles. So we'll be using those as well as we continue to grow out that program.
Commissioner Burning first.
Thanks for that. Just that's just such a common thing of people saying, no, leave it for somebody who needs it more, when in fact that's part of the problem is people who are eligible not using it, just like with food stamps. So thank you.
Thank you, Chip. You tried to pack a lot into a short period of time. I was having trouble following this. So I have a question. I remember in the mid-90s working with the Peace Health Foundation on healthcare modernization, same exact words. Back then it meant getting records more electronic from paper and then making them communicate with other providers. I am very unclear what you were referring to in terms of healthcare modernization. You talked about a foundation of public health, and then you started talking about things that to me just made public sense, and we could have been talking about 40 years. Could you succinctly tell me what healthcare modernization means when you use that phrase? Now that, because he's talking about moving into the 21st century, newsflash, we're 25% into the 21st century.
Oh, I believe me, I am well aware. Well, public health has been chronically underfunded for many years, so we are far behind 25 years. But I think the main difference between healthcare modernization is that we're not healthcare, we're public health, and public health is a very different enterprise than healthcare.
But you were talking about public health modernization. I just want to know what you're referring to. That's all.
Well, sure. Well, the foundational model really includes 4 primary programs. And then I think the difference, though, is those capabilities and really putting the focus on health equity and communication and policy and planning and all of those pieces that our public health workforce needs to be trained in to be effective in those. It's not technology. And we had a lot of discussion around the word modernization. It's not great. I sometimes just say transformation. There's the public health National Center for Innovation uses the term transformation, but I also see them starting to use modernization, which is interesting. I don't know if it's good or bad. It's probably good for us because
could you tell me what you mean by that?
I'm sorry?
Could you tell me what you're referring to?
About modernization? Public health.
Whatever, yeah. I mean, what is this foundational model that's new?
Or how is it different?
Public health.
I think that's what you're asking is like, how is it different from what we've seen in public health before? Is that?
What is it?
Well, there's a few basic tenets. One of them is that we do not silo funding, so that rather than saying this money is for tobacco prevention, this money is for TB treatment, this money is for suicide prevention, the goal is to really allow more local flexibility in determining what are the needs in the community. So, and especially I think in a county the size of Lane County, we are often subject to really what's happening in larger counties. Like they can really drive the agenda. That's true not only in our state, but nationally as well, the way funding is allocated. For example, we have a problem gambling grant. It's not a lot of funding, but it's the way it's funded. It comes from proceeds from video gambling in our county or in our state. But is that where we really need our prevention dollars? I am not sure. I haven't seen an assessment that really says, I'm not saying it's not a problem. Problem gambling is a problem. That is absolutely true. But the way that funding is allocated now is not really driven by what are the problems that you're seeing in your community. So that's one foundational element of modernization, is having more local control about determining the needs and responding to the needs. And then these other pieces about that I mentioned before, the foundational capabilities, it may sound like those are things everybody in public health should know, but I can tell you we have a lot of new public health staff coming in from, that had started with COVID, and that is terrific, but very few of them have training, official, kind of standard training or any kind of training really in public health, except on the job training, which is terrific. But there's so much more to public health, and learning how to craft a policy and to do policy development, communication, strategic communication. those are very specific skills that take very specific training. So to kind of highlight those and to create that standard across the whole country for this is what a public health workforce should look like and be able to do is very different than what we've seen from public health before. If there's very little communication, it was not standardized, and so I think part of the modernization piece too is trying to standardize public health services across the country so everybody can expect the same level of service no matter where they live.
Commissioner Buck.
I have a question about the mobile health services. So we know you got this new fantastic vehicle, but how are you able to utilize that in the rural communities, which I think this is primarily what you will be doing with your mobile services, especially those that are not within even a small city. It sounds like you may be going to events, but there's lots to do in between events. So I was just hoping you could describe what you envision there.
Sure, and I can talk about it a little bit, but it's also in development. So there will be more. We actually are hiring a consultant to help us with the clinical side because we have a lot of plans that are more on the prevention side, but there is a strategy at the state level when the declaration that racism is a public health crisis was passed that actually is very specific about the use of mobile services in communities to reduce health inequities. So we are contracting a lot with folks to determine what that piece looks like. It could be about bringing a lot of preventive health services out to communities and also connecting people with primary care. We will not be delivering primary care, but the connection to primary care is so important. So that's why we will align very closely with the community health centers. For example, 40% of the people who are assigned to the community health centers from OHP for Medicaid do not engage, don't have their first appointment. And we saw that a lot when the COVID response began because people would call looking for COVID testing and we would say, call your provider. And we heard over and over and over again, I do not have a provider. So the idea that Oregon Health Plan is there and available to everyone is, true in theory, but actually having people engage in care is very different. So that's something that we want to work on as well in public health. We have these great relationships with our community-based organizations, so we can also leverage those because they've built trust with communities. And that's really important because we don't necessarily have a lot of trust with government organizations in this county particularly. So that's part of it. We'll be also taking our own services out. We'll be doing STI testing, for example, and WIC, and some of those other services too.
Commissioner Boschwitz.
Thank you. So I assume we're finished with the division presentations. I kind of saved my questions for all four divisions really. But I'll start with and work backwards since you're at the table. There's a fund transfer in the budget for public health. Is that general fund, the fund transfer, the approximately $3.5 million?
General fund, but I don't have these.
Because at the beginning of the presentation, it was noted there's over $7 million in general fund that goes to H&HS. So I was trying to track that a little bit. I'm having difficulty figuring out where it's going. And if that is general fund coming to public health, exactly which initiatives is that funding?
Well, I can tell you where we use general fund in public health. Yeah. That absolutely is used in 3 different programs in public health. In communicable disease, there is, I think it's a little less than 1 million, if I think it's around 900,000, I could be mistaken. But the other 2 are WIC, and that's to maintain WIC services, because if we, for the very reason that if we begin to lay people off, we are able to provide fewer services, and that becomes a spiral where you tend to get less and less funding. So we're trying to maintain that as we rebuild back WIC. And then the last place is maternal and child health, which is now actually called family child health. They're making an official name change for those services, which includes our nurse home visiting programs. And that is for the Medicaid match that we need to be able to pull in down the Medicaid funding. So it's in those 3 programs.
Okay, thank you, I appreciate that. Really didn't have any questions for HSD other than just placeholders. Steve, I need to ask you about reporting rental assistance fraud for landlords. Okay. I'm aware of a particular landlord that found out that there's been 6 applications for rental assistance for his 1 house. Yeah, and 2 of them granted. and he's never been paid for any of the rent. Developmental disabilities. The last several budget years, you guys have been running what looks like a surplus. And 1920, it was 3 million, 2021, 1.3, 21, 22, 3 million. And even this year, you're proposing 400,000. Is that being put aside in a reserve somewhere? And is it mixed in with all of H&HS's reserve?
No, it is set aside in reserves, and it is a portion of the prior reserves went to the building.
Okay.
And there is still some money in reserves, and that's part of what we're adding those 15 positions.
I think that would show up as an expenditure in budget if you spent it. That's what I'm getting at. Is I'm not being able to track. I'm getting reporting on these divisions of resources and expenditures, and it looks like we're building up reserves in a lot of these departments, because public health also is showing surpluses.
So we
in that
will
way.
have, for what I can tell you, for developmental disability services, and we're projected to have, I think it's 6 million in reserves, but a portion of that is going to go to those 15 positions if it's approved. Mm-hmm. And then a lot of the reserves that we've been built up has been due to vacancies in part, and so we are looking in the future. That funding does need to go to only for the purpose of
that's what I was hoping. It's being set aside by division, but it's not easy for me to track, and even with the 15 positions added, you're showing
we still will have
showing adding to the reserve for that division, which that's a significant amount, 7 million or so. Yeah, so that's why I was trying to track that.
In Health and Human Services, they track their reserves and contingency by program service. So wherever it's generated, it stays in that particular program. Unlike in public works where they offer a fund and consolidate Health and Human Services, it's in each individual program.
Yeah.
So if WIC, I'm not saying they do, but if WIC were to have a reserve, it would stay in the WIC program.
Yeah, and that's mostly because a lot of the federal and state funding is tied to the program, not to a fund. Whereas the road fund is restricted by the fund, not the program. Yeah, so I get that, but I was trying to track it a little bit. Last question: community health centers. There's 335,000 in local revenue. Is that the one-time general fund for the building of the clinic in South Lane?
Those are private donations for the fundraising for the South Lane Clinic that just flowed through the CHC.
Okay, I just was, local revenue says general fund to me, so I was trying to figure out where that was coming from. Thank you.
The general fund will be in a fund transfer.
Yeah. Thank you.
Christine, do you need to add anything to that?
Well, I was just going to add, the building that was referred to, the funds would be transferred to the capital fund, and transfers don't appear in a program budget. They belong to the fund. So it is somewhat about how things are reported in the budget document. We definitely have all that detail for you where we could run developmental disabilities and we would see, every line item and see transfers with it. But it's a little confusing on what belongs to the fund as a type of expenditure and what belongs to the program. And in your program budgets, department budgets, you're only going to see personnel, M&S, and capital.
Just trying to follow the bouncing dollar.
Other questions? Oh, yes, Mr. Farr.
Thank you, Chair. Two things really quickly, Steve. It came as a shock to me when I realized that Gilby Riley reported to you. For some reason that just didn't weigh to me. That was several years ago that I found that out. But I have a question though regarding the Steve, you've done so much work through the years. I can't help but talk about Steve Manella.
I hear you had a throw once. No, I'm sorry.
There's also almost world-class miler. Okay, I'll call you world-class. The question that I actually have is regarding universal nurse home visiting. And we currently are performing some nurse home visiting. So this is going to universal, where you said that every child born in Lane County would have a postnatal visit?
I say that every family in Lane County will be offered.
Offered.
We have found through some of the communications that when you say every family will have, it sounds to some families like you're going to be sending out a nurse
Right.
to check on them.
Yeah.
So we offer the service. It is not mandatory.
That's the key word, offer. Thank you very much for that. And this is strictly for the child, is it? Or is it a mother-child?
Oh, it's absolutely for the whole family.
So we're prepared for mental health issues, behavioral health issues often surround.
They will be able to absolutely connect people with the services they need for mental and behavioral health as well.
And here's a hard one. Is it only for live births?
I'm sorry.
Is it only for live birth, or will that be extended to women who lose a child?
Yes.
It is, yes, only for live birth.
Okay. No, I recognize that is an interest. I haven't had that question before. I can ask about that, but yes, that is the model now.
I have just a detailed question about the mobile unit and functionally how that works when it drives from Eugene to Florence and has an event there. Does the staff spend the night? Do they have to leave super early so they can get back and spend the night back here? When they're out doing rural visits, will there be multiple days that they're on the road, and do they spend the night out there, or how is that functionally? Is there any bedding in the unit that where they can just like?
I don't think we would do that.
That's creative. Just trying to think like how it works functionally, because there's not a lot of motels out in Triangle Lake or. So just curious how that's going to work.
Well, we do have policies around how far you can travel before you can have an overnight, and even when your hotel is covered. So we follow those policies for sure. Generally, people will not be exceeding 1 day. I can imagine around planning that there may be an event that's multiple days and something may come up, but I think that would be an exception. Yeah. Okay. I think we want to secure the vehicle too. I would be nervous about leaving the vehicle out in the community. We'll see how it goes.
Thank you. And I can speak to, we do have rural outreach services today in many of the distant portions of our county. And those are day trips. So I agree with Dr. Warren that there may be multi-day events, though, as we look at building mobile services as a program, we're not going to look at it as division specific necessarily. We're going to look at what mobile vehicles do we have available, and then who all can we get to board onto that vehicle so that we can provide the most comprehensive service possible in a single visit. Because of course, it just doesn't make sense to go out to the same community with different vehicles and with every division. That's not a good way of connecting with folks. So as we develop the mobile health strategy, you will see that our divisions will start to come together and have conversation about how we make this a reality on an ongoing basis, not just for events, but for ongoing outreach, similar to, like I say, the rural outreach programs that we have today.
Thank you.
Other questions from the committee? Okay. Thank you all very much.
Thanks for coordinating your color palette to work with the committee today too. Appreciate it.
That was 1975, but not 95.
Emails about the CHIP program.
Yeah,
Something that we
yeah.
really have cases like that.
Thank you.
Okay, we are kind of at the slot in the
schedule.
schedule where we've got a break scheduled. So why don't we go ahead and let's take 10 minutes. And then we're going to roll through Public Works and Emergency Management after that. We are.
Okay.
We are good with that?
No, I'm just saying that Public Works is not here.
Yeah.
That's why I gave.
get back with it. So into Public Works, Mr. Hurley, kick us off.
All right, thank you, Chair. Thank you, Budget Committee, for serving again. Glad to see you're all returning members. Hello, Bruce, out there. Good to see you. All right, so we will have a more focused conversation. I like the direction you're heading, where we'll focus on the distressed funds primarily. So we have with us 4 divisions representing 3 funds today. So we have our division managers, Peggy Kepler, Warren Schumacher, and Peter Miller. And then stepping in for Brett Henry, our Parks Division Manager. We have Jordan Carlson, fairly new to the organization, our Parks Business Operations Supervisor, something like that. All right, just want to give a shout out to my budget team, who's been working very hard behind the scenes. Paula is our new Admin Services Division Manager. Fahad Kazi was leading our budget team this year and did a sorry, it's Fatalities. And Fahad Kazi led our budget team this year for the first time. He did a fantastic job making that a smooth process for us. So thank you, all my team. So this, and where's the clicker, or how are we doing that? Okay.
Tanya Ellis is running it.
Okay. Thank you. So there we are. There are the 4 fund or divisions you'll hear from today. Engineering and construction services, that's and road and bridge maintenance share our road fund. Our road fund isn't distressed, but it's been through a lot of volatility over the last couple years due to COVID. We drew down our service stabilization reserve pretty much to nothing, $2 million cut out of that. We've since been made whole through a combination of state COVID relief money, the ARPA money, and SRF. So with this budget, we are replacing that lost reserve, and we've been more than made whole. So we're looking in good shape, actually. But we are doing some significant changes with staffing, adding staff in both the ACS, road and bridge maintenance divisions, and doing a shift in putting less dollars in our capital annual amount. Because we've found that we just don't have enough staff to carry out the projects that we keep budgeting for. And so we looked back over a 10+ year period, and we were annually having about a $2 million lapse of projects we didn't get finished. So we're adding staff, and we plan to draw down our reserves for future projects reserve, which is an excess to our required reserve that we've built up over the years because of that lapse. So looking forward to getting more projects completed with having the amount of staff that we need to carry those out. Land Management Division is our most concerning fund right now as a result of primarily the Holiday Farm fire. The board made the direction to waive fees for the wildfire survivors, which was terrific for all those folks trying to rebuild. But we had to add staff to cover that as well. And so we're very structurally imbalanced, I think, to the tune of $2.8 million. So we need to figure out how to close that gap still. We did get an influx of some ARPA money. Thank you, commissioners, for that, $1.5 million to help plug that hole, but we need to develop some solutions for longer term. We will be returning to look at fees, but it really can only get us part of the way there. We don't want to have fees too high where it's an impediment to people who are trying to build. Our Parks division, our Parks Fund has long been an area of concern. We just don't have the staffing we need to maintain our 68 parks out there. So this has been an ongoing conversation with the board. There was a task force set up to explore different funding options. We will likely be coming to the board soon to start talking about a levy in the fall. So hoping we might have luck with that if the board wants to go in that direction to close that, at least for a 5-year period, is what we'd be looking for as a levy. Of course, we have 4 other divisions in Public Works: Waste Management, Lane Event Center, our General Services, which includes fleet and animal services, an odd combination, but it works for us, and our Administrative Services Division, led by Paul. Next slide. All right, so for our resources, you can see we have the largest portion are state revenues. That's primarily coming from the state highway allocation It's a bigger piece of the pie than in the past because we have that $20 million up there from ODOT for territorial highway. We're receiving 3 payments. This is the second payment. We've received a $5 million. This is the $20 million, and we'll have another $5 million payment as we take on sections of that 40-mile highway there. So usually our state revenues there are pretty balanced with our fees and charges. So it's about $35 million there in the fees and charges. That primarily comes from tipping fees for waste management, the garbage fees that people pay. But then there's also user fees into fleet and land management division. Obviously charges permit fees. The general fund support, sorry, gotta make my notes open here. We do receive a small amount of general fund. It's very critical for these 2 divisions here in animal services, part of our general services. That accounts for about 71% of their budget. So we're very reliant on that. And then Parks has become reliant on funding 2 positions that are critical for their small operations to sustain their parks operations. Next slide. Expenditures, we're proud that we were able to keep our personnel and material services increases pretty modest. So we're under the required CPI amount that we were shooting for, which we'll see how that goes with the inflation numbers, but planning to keep that modest. Our capital expenditures are up about $500,000. That's driven primarily by, we have a very large project out at the landfill, finishing up phase 6. It was such a large project, we had to do it over 2 construction years. So another $13.5 million on that project this summer to finish that up. We have a number of projects in roads. Peggy will probably talk about some of those. The fleet fund expenses, that's just the replacing of our equipment. We have some very expensive equipment that we replace, heavy equipment. So $6.4 million in expenses there. And then Lane Event Center has a big project for fire suppression out at the convention center. So that's about a $300,000 project. Next slide. All right, we'll move into our divisions and then I'll have some slides at the end to wrap up. So Peggy, or no, yes, Peggy, your questions.
So go to the next slide. All right, good afternoon, Chair, Budget Committee, Commissioners. It's good to be back in person sharing what ECS does. ECS is Engineering Construction Services. And we have 5 primary engineering and construction related services that we provide here at Lane County. We have our engineering services, which includes both design and environmental work. Then we have our construction services that has inspection and materials lab that does all of our testing on our projects. We also have our transportation engineering services that includes transportation planning, permits, and traffic operations. Traffic operations is our signals primarily. And then we have survey services, which includes our corners, subdivisions, construction, and right-of-way group. And we are here to provide comprehensive engineering and construction planning, design, and contract management. We propose 58 FTE for FY 22-23. Go to the next slide. We're requesting 4 FTE. 2 FTE will be added to the environmental engineering section. And this will help us administer and implement the increasing federal stormwater regulations that we have upon us. And one of those requirements includes functioning erosion prevention program. This is for during construction activity that we watch any construction that might impact the water quality. That has to be implemented by February of 2023. We're also requesting 2.5 FTEs to support the transportation planning and utility permitting section. These will help us to manage the number of permits that we're seeing with our utility companies and also preparing for succession planning as we see retirements. We are also asking for 1 FTE to help in design to work specifically on the territorial projects. We will be receiving the $20 million in July, and we do have slightly around $60 million worth of work on that road. So we're going to be looking at different challenges over the next few years. This so these positions are just going to help us to take and implement the different programs. The erosion prevention, we also have the traffic communication plan. We are closing in on that right now. This is a plan that will connect all of our traffic signals, and we will be able to operate them at the office primarily, and not always running out to fix the timing. So it's a communication system. And lastly, ECS will continue to take and help our various communities. We have one position that we're in the process of making an offer to someone right now, which will include what we call the special districts infrastructure design, and they'll be starting with the Blue River water and wastewater programs out there. So we're anxious to see that. Next slide. So ECS recognizes that much of the work we do supports the goals and objectives of Wayne County's strategic plan. We're actively implementing safety measures that reduce fatalities and severe injuries on Lane County roadways. We're establishing best practices for stormwater management to improve our water quality. And we're partnering with communities to construct cost-effective infrastructure. And that includes both the special districts and what we call the COBOs, which are certified on behalf. ECS is a certified agent for ODOT. So when smaller agencies get funding, federal funding, they can't deliver their projects, and we have the ability to do that and support ODOT and the communities. Next. So in FY 22-23, our key initiatives include completing construction projects. We have 8 of those projects at $8 million. And then we have one of those projects includes the Lundy pedestrian improvements in Lowell and the Row River deep culvert replacements in Cottage Grove. We're also designing a number of capital improvement projects such as Kitson Springs, slide repair, and we're also helping the city of Springfield with the design of the McVeigh Highway. We're also publishing our Lane County Bicycle Master Plan and the Traffic Communication Plan, and we'll be implementing both of those over the next few years. And lastly, we have recently started using a drone to do our surveying work. So this is new technology for us. And that's it for me. Warren?
Thank you, Vicki.
Did I forget something?
No, I said
Whatever where my name tag was. Commissioners, committee members, thank you for listening to us today. So I'm Warren Schumacher. I'm the road maintenance manager with Public Works Division. I'm going to briefly run you through some of the budget items we have in our budget and just paint a picture of what we do in general. So that's what this first slide is. You guys, a lot of people know us for their journeys to and from work. So that's the pavement preservation side of things. That's our backbone of the work we do. Striping and signage is another big part of our program. We have over 22,000 signs, growing every year. We continue to add them over time. So it's a growing thing that we have. Bridge maintenance is another big side of us. We actually are called the Road and Bridge Maintenance Division. I shorten it to the Roads Division all the time. We have over 440 bridges in Lake County. That's a vast infrastructure of bridges across the county. So a big part of our job is having the bridge crew maintain those and working with our ECS team for their design side. And then finally, vegetation management. It's not the least, even though it's at the bottom. It is a big part of our program. That's our roadside mowing, and it's becoming more paramount in our recent discussions because of the fire seasons we're having now in Oregon, as we're a mechanical program and there's a lot of fuels that run along our roadsides. So it's a big discussion these days in that program. So that's kind of what we do. There's some of the summary stuff about the size of our FTE and our budgets. And then I think we can jump to slide number 2. So some of the changes, and I think why the Roads Division is presenting to the committee this year, we're not a distress fund, but we have plenty of stresses. And one of those stresses is trying to ensure we have enough people to do the work we have on our roads and bridges. So what we are proposing in this year's budget is an addition. It says 6 FTE. We are actually adding 8 positions, but we've reduced in our proposal 4 of our 6-month positions, so that it's a total add budgetarily of 6. But of that, what we're trying to do is develop with the territorial expansion. I'll jump into that next. But with that addition, we're picking that up from Highway 126 up the Benton County line. It's 17 and a half miles, 7 bridges. We're adding to our maintenance system this year as part of the 3-phase transfer to territorial. So we're asking to add an operator position and a senior operator position in our Bonita crew. That's the crew that will do all the maintenance in that area of the county. And then we're also requesting 6 what we call RM worker positions. These are the labor positions. Believe it or not, not everybody wants to run equipment in the roads division. There are people who have come into our division who just want to work, not run the big equipment. It's scary for some people. So what we've tried to do is grab the people who are really good at the operational side, give them the joysticks back, and provide the labor position so they're not having to do the traffic control. So we can get more efficiency out of the skilled operations side, giving them support in those worker positions. So that's something we're excited to propose and add hopefully in this budget. The phase 2 of Turwetaw Highway, like I said, is effective July 1st. It's 17 miles, 7 bridges. So again, that's why we're looking at those additional positions. In that, phase 3 will come in 2024, and that will be what's between, call it Gillespie Corners and Highway 126. So if you know those areas, we're grabbing phase 2, and phase 3 is shortly behind it. One of the ones I'm most excited about is this $250,000 maintenance fund for small projects. What we find in maintenance often is you get surprises. You may think you've got a great plan and everything's going well, and then a drought comes and a road falls, or a flood comes and a road slips. So what we want to do is have this nimble access to monies where we can quickly and rapidly respond to customers' concerns and also get some lower cost capital projects out that don't have significant design. So our ECS team is working with us to come up with these kind of better lack of terms, cookie cutters to go out and be able to mimic this similar scope and project, get an estimate, put it to work quickly on a road, hopefully within a year. So that's the goal, is that every year we will have this money available to quickly respond to projects that show a need that weren't in our plan. So that's what that's about. Slide 3, I think. So roads doesn't have a lot of direct correlation to the strategic plan. There's lots of things that, this is the part of it. But we do connect in these 3 ways. Sorry, my slide was different. So I'll go through those connections, but when looking at the strategic plan this year, we do have ways that we connect to it, but there wasn't a lot of direct correlation to roads. But I think these things point to the fact that we're still trying to work and ensure that we're aligning with the strategic plan of the county. So establish traffic safety presence in combination with engineering and education to reduce traffic fatalities. Everybody knows that traffic fatalities across the state, honestly across the nation, are going up. You've probably seen it in your own driving out there. There's people going a lot faster than normal and doing other activities on the roads that are unsafe and leading to that. But on our end, what we're trying to do is work on the education and implement safety strategies on those roads to do our best part to minimize those if they happen. That includes looking at widening fog line strips from 4 inches to 6 inches, so they're a little better to see at night. I'm finding that. I'm 49 years old now, and even me at night. Is that a good fog line? So that 6 inches hopefully will help. Rumble strips, you're probably seeing what are called chevrons at corners that alert drivers when they're maybe going a little too fast and there's a corner ahead. So working with our engineering services team, our engineering construction team, on what we call our fatal crash investigation team, and the SEIT, which is the tongue twister, systematic engineering implementation team. So all those conjunctions trying to reduce fatalities is part of what we're trying to effort on that. Road infrastructure is road and bridge maintenance and investments in technology. We're doing a lot of adaptation. We're kind of a older program that technology wasn't as quick to come to, so we're trying to rapidly catch up. We've implemented iPads across our division. We're seeing a lot of mobile training for our crews to use those things so they can be efficient out in the field, not having to do reports later at the office. We added an exciting program we're hoping to make public facing next year, which is called Visalia. It's a winter prediction program that actually shows our roads and the use of weather stations and other NASA level technologies, as they say, will give us these algorithms that show when a road might freeze throughout the night. And so we can better predict when we're going to call out crews and schedule them to go out into areas that are problematic in the county. It's pretty exciting for us. We started it this year. We want to see how it'll look through the winter, and then we're looking to hopefully make it public facing so people can have that as a resource as they prepare to drive to work. So good tool. Hopefully we can make that happen here soon. Protocols and processes for staffing emergency response. We're working with Lane County and Patience Winningham, and our emergency team has done such a great job in advancing us in such a short time. So what we're working with them is to develop protocols in alignment with these larger structures to respond to large emergencies. So that's been a big focus and will continue to be in the coming years. Applying equity and stewardship lenses for maintenance plans. So some of our planning team in ECS has developed a lot of these kind of geographic understanding of socioeconomic and racial profiles across the county where we can look and help determine that as one more lens to look at when we're planning a maintenance project. So we're trying to be as equitable where and when we do what we do to ensure obviously project priority is going to lead that, but as long as we have one more thing we can look at, hopefully that'll help direct some of our programs to people who may have a need for them based on, you know, parts of the county they live in. Would we be more rural, urban, kind of dividing those issues in our planning process. And then this one's the biggest one to me, and that's our people and our organization's health. We all know that the last 2 years has been a very challenging time for us in both personal and professional lives. We are a large division with over 101 proposed FTE. We've been wearing a lot of hats, and what I'm hoping to do is try to get people back to a sense of our purpose, our understanding and direction through that. And so we're going to be implementing a lot of reintegration with who we are, refocusing on that, amplifying our training volumes and getting people back to where I feel like we're healthy. We're heading there, but I feel like we're still in the fog and we need to come out of it. So as much as that may not sound financial, it is. It's a big part of our budget and it's a big focus for the health of our workforce. So that really is, doesn't easy to put a number on. Some things in this world we know are priceless, and that's one of them. So we're going to keep working hard on that for the coming years. Slide next. So key initiatives for us in the fiscal year 22-23, mitigating fire risk and emergency response. The holiday farm fire is not over. The flames are gone, but we're going to be working up there for years to come in so many different ways. So we're continuing to work on that. Plus, what we don't want to see is another one of those. So on the roads, we've put in for a 1.5 million hazard mitigation grant with FEMA. It sounds promising. I never like to say anything until we have it, but we're hoping to get that. And what that is we're looking to reduce fuel risk along our county roadsides and partnering with agencies and trying to get federal monies to do that. So we're hopeful if we get that, we can start taking care of a lot of these trees that have been dying in the drought stress issues we face over the last few years. So that's good money in addition to our program and those things. And again, that'll include our emergency response with our emergency management division. Divisional training. We want to extend that. We've about doubled the budget in our training. It's not a large budget item, but it's a critical one because during the COVID time period, a lot of the training in the roads programs across the country just didn't happen. They stopped. And so we're trying to reintegrate. So in the last few months, we've just been saturating staff with opportunities to go back out and reconnect with our agency partners, rebuild those relationships. There's been huge turnovers across, you know, Lane County was actually fortunate. We didn't have a lot of turnover in our roads division, but other counties have, the state sure has. And so we're getting back everybody familiar with one another and coordinating those efforts through training. And then overall, the biggest part of us, obviously, in the roads division is maintaining a pavement condition that is hopefully the best in the state. We've continued to strive for that. We've been there. We're going to stay at the top. That's our goal. We want to make sure every road we have is in fair or good condition. That's the rating system. Your PCI is a number we use, pavement condition index. And we're striving to keep that high through the backbone of our programs of crack seal and chip seal and ECS's paving side. So that's kind of roads in a snapshot, where we're looking to go, our key initiatives, and really the biggest ask for us this year is that $250,000 in small project funds, and then the FTE funds. So I'll be here for this.
Okay, thanks and good afternoon. Budget committee members, commissioners. Again, my name is Keir Miller. I'm the Land Management Division Manager. And the Land Management Division of Public Works, we're that part of the organization that deals with land use and building permits. Our program consists of 5 key areas. Our building program, which also includes electrical inspectors, our plans examiners, our field inspectors. We have a code enforcement team, small but mighty team of 2.5 FTE that enforces all of the code enforcement regulations for the county, including nuisance and hazardous buildings and waste and land use violations, and just down to the basic folks don't pull permit or illegal camping. So a range of different functions there. We have our coordinated services team, which this is really our outward facing customer service team that provides information, answers questions over the phone and in public. And then we have our land use planning section, which consists of long-range planning, that's comprehensive planning, as well as current permit processing, issuing special use permits for development, things like that. And then finally, we have our on-site sanitation program, which deals with septic systems on private property. We currently have 48 FTE. As Dan mentioned, we unfortunately are one of those programs within the organization that's structurally unbalanced right now. Again, this is primarily due to a decrease in personnel costs, a policy to mitigate permit fees for folks recovered from the Holiday Farm fire, which everyone recognizes is critical and necessary, but it does have impacts. So next slide, please. So speaking of personnel costs, I just wanted to highlight, we've added 10 FTE in the last couple of years to help address wildfire recovery. This chart goes back over well into 2008, I believe. It shows sort of the FTE levels in LMD over time. And one thing I want to point out is, though we have increased the division significantly, 10 FTE in the last couple of years to address this Holiday Farm fire, glut of permitting work that we've seen. This level of FTE still, it's barely comparable to what we had seen in the past during like the housing bubble, for example, where we had 45 FTE, 42 FTE. And I guess the point of this slide is to let the budget committee know that even though we have structural imbalance, and we think that eventually this work, processing permits for the Holiday Farm fire will subside to some extent, and we can potentially reduce some of those personnel costs because of that. We still are at a point just prior to the fire where we were down a good 5 FTE prior to where we were in the past. So what I'm saying is that land management has been chronically understaffed. We've had a challenge meeting customer service expectations. We have staffed up, but really that additional staff is focusing on wildfire recovery. So my concern is that long-term, as we start to push through the Holiday Farm fire permit activity, we don't just drop off and reduce staff to the levels where we were a few years back, and we're behind the 8 ball again trying to deal with customer service expectations.
Here, can you brief the 3 event lines?
Yeah, sure. And these 3 event lines on this chart show the first recession after the housing market collapsed in 2009. That's when we went from 42.5 FTE down to 22 FTE. Land management, almost a 50% decrease in staff. We really suffered there for a number of years and just hovered around 30 FTE. And then we saw that last big hit that the organization saw in 2003, where our numbers went back down to 22 again. So again, really just a challenge for the division. And then slowly over time, we started to rebuild. And we've done a good job over the last several years, rebuilding slowly and building reserves. And that's why we're actually able this year to address this shortfall out of reserves, but that's not a long-term, as I mentioned, we have 2.8 million operational deficit. That's not a long-term funding model. It's not sustainable to keep drawing down on reserves for that. But we are lucky to have that right now. And then finally, that last timeline indicator is the Holiday Farm fire. And you can see the increase in staff right there from 37 FTE up to 47. And then this year, and I'll ask for the next slide, please. We're actually going to be proposing the addition, even though we don't have a strong fiscal outlook, we are in a position where we need to add additional support. As Ms. Kepler mentioned, the county's taking on more federal responsibility for wastewater management. Land Management Division does have a part in that. We'll be asking for the addition of 1 FTE to help with the field work associated with inspecting on-site runoff for construction sites. So that's a concern, but that is 1 FTE addition that we're requesting. Other challenges for the coming year, obviously cost recovery is difficult. The Land Management Division is not general fund supported. We are intended as an enterprise funding model. We're supposed to generate the majority of our funds through permit fees. Of course, that presents issues. Most other jurisdictions in the state that do similar permitting work, they do rely in some part or a large part on general fund. So they're able to keep their permit fees lower than us. So we recognize that there are challenges in Lake County with general fund support, and really we do need to keep our fees somewhat in line with the true cost of doing business. And we'll talk a little bit more about that shortly. And then finally, even in those programs that we are able to support with permit fees, building and land use services, for example, there are portions of our organization that just can't be funded for permit fees. Things like customer service and code compliance. These aren't things that typically you can charge a fee for. So those are some of the changes and challenges that we're experiencing. Next slide, please. So we see land management aligning with the strategic plan in two key areas. That's vibrant communities and safe, healthy county. Really, land management does a number of things to support a safe, healthy county. We partner with emergency management, maintain our community wildfire protection plan, which is critical these days. We operate two separate incentive programs to help wildfire survivors, as well as folks trying to prevent future wildfire disasters. We administer our FireWise program, which is basically a pass-through program that takes federal dollars and gets it out in the community, as well as a state fire hardening grant program that we're administering funds to survivors of the wildfire to help them rebuild in more resilient ways. In addition, we, again, as far as safe, healthy county, we enforce land use and nuisance and code violations. And then around vibrant communities, land management is involved in a range of different activities. We work collaboratively with our regional partners, the small cities, promote comprehensive plan initiatives that they're working on. Right now, staff are involved in the accessory dwelling unit code update, which will open the door to hopefully a lot more low-cost housing options throughout the county. We've, since prior to COVID, took a really aggressive initiative to modernize land code, which hadn't been really brought up to speed in decades, and we're trying to make the code simpler, more streamlined, and more easy to navigate for folks trying to pursue development in the county. And finally, we're working to support the Holiday Farm fire recovery efforts. We continue to see a high volume of permits. We think we're about 35% through the volume of permits that we might get from Holiday Farm fire survivors. To date, we've processed nearly every single permit we've received. Now we're working through the inspection process as those folks build. We expect that to be a continuing obligation for several years. Final slide. Next slide. And so key initiatives, since I was mentioning, I'll talk more about the Holiday Farm fire. We've looked at other examples from around the country, and we see that it takes 5 years out. A lot of these communities are only 50% rebuilt. As I mentioned, we've gotten about 34% of the permit activity submitted in the county so far. The county has just revised its numbers of potentially lost homes in the fire. That's kind of a moving target, but initially we were looking at a number around 473 lost residences, and that's been bumped up to about 570 because of new data. That plays into the calculus of how long we're going to be in this and how many permits and what percentage of permits we're going to be working on to assist residents. So that's a major effort moving forward. The other initiatives that we're excited about is obviously improving our customer service. The commissioners hear regularly about concerns about permit wait times and costs. And, so one of our big initiatives is to really work with our key stakeholders this year, talk with folks in the development community, the land use watchdog groups, get an understanding of the key issues, and really have a good dialogue. It's been a couple of years since we've really engaged with the public with COVID and everything else. We want to start that conversation back up and learn from our constituents and the public what we can do to improve our services. Along those lines, land management is undertaking two really comprehensive, they're a combination of policy or program improvements, process improvements, and technology enhancements. One of the things we are pursuing is what we're calling our citizen platform. It's going to be an online way that the public can transact with land management. It's going to consist of an online permit submittal application guide that walks individuals through the permit process, tries to take out some of those complexities and ambiguities, and really helps folks submit a complete application that we can then turn around and process quickly. Another piece is this sort of portal that lets the public know clearly where they're at in the permit process. So we're hoping that can really reduce a lot of frustration when folks are not understanding where the permit's at, or maybe there's a piece of their permit submittal that is out of the county's court, and in their court, we're waiting on some key information. We want to have those lines of communication clear, and really a goal for us is to just provide outstanding communications to the public. And then finally, in line with what I was speaking about earlier, we really do need to look at a comprehensive fee analysis for the division. It's been a number of years since we've really studied our fees, tried to understand where we're at in terms of cost recovery. The last comprehensive fee analysis was done in 2015. We know at that time when we did that fee analysis, the majority of our fees, we were only recovering about 70% cost recovery. So we knew that there was a portion of fees or a portion of our services that just weren't being covered by fees. With inflation and rising costs, we know that's increased, and it's time that we looked at that again. We will be coming to the Board of Commissioners on June 10th with a modest fee increase proposal, which is based on the consumer price index increases over the last few years since our last fee increase. So it's probably gonna be around a 9 or 10% fee increase. But on the tail of that, we are gonna undertake this more comprehensive fee analysis and look at our fees and figure out where there may be some permit fees where we're right on the money. We're charging, the accurate amount of what the market will bear. There may be some parts of our fee schedule that we're way under market on and we can adjust. So that is our plan moving forward. And that's really critical given, the fact that Land Management Division, the majority of our staff are within the AFSCME bargaining unit. We just went through bargaining with that work group. We went through a lot of market adjustments with those staff and brought them up hopefully into market, but our labor costs didn't increase significantly with that last round of negotiations. And with that, I will turn it over to Bjorn Carlson, and I'm available for questions.
Chair, forgive me. I'm sorry. I'm going to have to excuse myself.
Do you have a question for you?
No questions. I'll catch up. I'll watch the tape.
I'll ask his questions. He's good enough.
Okay.
Okay. Thank you very much.
Thank you.
And I apologize.
Bye.
Hi, my name is Bjorn Carlson. I'm filling in for Brett Henry, the Division Manager of Parks. The mission of the Parks Division is to responsibly manage, sustain, and enhance our parks and natural resources through partnership, stewardship, and customer service. Parks Division operates and manages 68 properties, including 5 campgrounds, 3 marinas, and 29 boat ramps through direct ownership, leases, and cooperative agreements. Next slide, please. Parks anticipates no direct changes to service or FTE in fiscal year 23. However, Parks does have 3 ongoing areas of concern. The recently completed facilities condition assessment assessed 17 parks with the most infrastructure and quantified the deferred maintenance backlog of over $21 million. Failing water and sewer infrastructure at Armitage, Baker Bay, and Richardson campgrounds are threatening to affect campground operations above and beyond their current restrictions. And seasonality and reservoir policies have affected water levels and shortened the moored season. Additionally, deeper drafter sailing vessels have increased difficulty launching and operating when reservoirs are below optimal levels. To mitigate the effects of the deferred maintenance, Parks was awarded $4.2 million to the American Recovery Plan Act for replacement of water and sewer systems at Armitage, Baker Bay, Perkins, and Richardson. Next slide, please. Vibrant Communities identifies an objective 2H to implement strategies from the Parks Funding Task Force to provide sustainable funding for parks. Robust infrastructure calls for investment and utilization of county-owned facilities, with the objective E1 noting the need to explore and secure grant funding to upgrade public infrastructure. Parks has secured external funding for the upgrade of several county-owned facilities, including ARPA funding for the water and sewer replacement at Armitage Campground, National Park Service RTCA program funding for project planning at Eagle Rock as we rebuild from the Holiday Farm fire, FEMA funding for rebuilding the restrooms that were destroyed in the Holiday Farm fire at Forest Glen, Oregon State Marine Board funding for designing a boat ramp facility at Forest Glen, and Oregon State Marine Board funding for a waterway access at HBRA. Key initiatives for fiscal year 23 include continued implementation of the 2018 Parks Master Plan and the HVRA Habitat Management Plan. Project identification, prioritization, and development based on detailed analysis of the facility's condition assessment and pursuance of a sustainable funding measure as recommended to the Board of County Commissioners by the Parks Funding Task Force. Thank you. Thank you for your consideration.
Slide. So moving on to our performance measures. So we have two areas within the strategic plan where we have measures that we report against. We also have a broader effort that we're starting in Public Works to have key performance indicators for all our divisions. We're pretty excited to finally get moving on that. We just hired a position, new position that we focus specifically for Public Works data housed in technology services. So we're just getting that project off the ground. But the ones that are in the strategic plan, first is around enhancing transportation safety. We have our Towards Zero Deaths initiatives. And Oren talked about a number of the safety programs we have around this. Another key one is our FSIT, our Fatal Crash Investigation Team. This is a broad team of different entities around the county that work on our 3 E's of education, enforcement, and engineering, all aimed at trying to reduce fatalities on Lane County roads. So our performance measures in there, the first one is reducing the number of fatalities on Lane County roads. So we had for the last 2 years been on a reducing trend from 12 to 9. We don't project out into the future, hoping that will be 0, but we're way off from that. Reducing number of severe injury crashes to 0 would also be our goal. That's all TBP to be published. Unfortunately, there's quite a lag, more than a 2-year lag to get the data from the state. So unfortunately, we don't have any numbers to report for this period of time. We have a commitment to complete safety audits on 100% of our pavement projects, and we have been doing that and anticipate that we will moving forward into this next budget year. Convening the FSIT team. We were meeting monthly. You'll see looking after 22, 23, we're decreasing that from 12 to 8. We're actually adding numbers of meetings overall to 16. We're going to quarterly on the FSIT and also adding in, we have a new safety corridor. It's our first safety corridor in Lane County for London Road. And so that's also meeting quarterly and it does similar work. So we're actually increasing the number of meetings, but it doesn't show specifically in that. We have a commitment to spend at least 5% of our capital improvement plan budget on safety improvements. And we have been doing that and anticipate doing that into the future as well. Next slide. Our other big area is around reducing waste in Lane County, improving our recovery rate. So our goal is to get to a 63% recovery rate by 2025. So of all the waste generated in the county, 63% of that would be diverted to energy recovery or recycling, but anywhere out of the landfill. And we've been working towards that, making steady improvement over the years, but we still have about a 10% piece to go and a shorter period of time to do that. We do have a big initiative going on right now to look at scoping a waste processing facility paired with anaerobic digestion. We have an RFP out right now and anticipate that we'll start getting proposals back in about a month. So I'm pretty excited about that. So the sub measures in here are to reduce food waste by 5%. Again, we don't have data in here because we rely on the state. They do periodic waste characterization studies going through the garbage and figuring out how much is food waste, and that's only done every couple of years. So we don't have data there yet. Providing our master recycler training 3 per year. We weren't able to do that in 2021. Obviously, COVID presented some challenges around that. We did do 1 virtual class, but that's a lot of classroom time to sit virtually. So we're pretty excited to get that back. We're actually planning to kind of make up for our shortfall and have 4 in 21, 22, and 22, 23. We we commit to 40% of our budget going to public outreach, trying to teach people about the complexities of recycling so that we can get towards this goal. It's ever increasing and continually changing. I just heard where they're going to be taking pizza boxes, food contaminated pizza boxes now, which we're actually not too excited about because it goes contrary against our messaging about food contaminated paper, but it's always a moving target. And the last one, conduct a minimum of 5 rural household hazardous waste collection events. So we get out into the rural communities, collect household hazardous waste for free. Again, we were hampered by COVID and doing those gatherings and things, but hoping to get back on track with that this year and looking forward. We've also been very short-staffed in that program. Next slide, which gets us to some of our future challenges and opportunities. The big one that everyone is experiencing, recruitment and retention. It's just a tough labor market out there, and all of our divisions are experiencing that. Particularly for our seasonal hires. So we're getting creative. Oren was talking to me today about making a commercial, our first one to try to advertise for seasonal hires, but to try to pay a competitive wage when folks are getting over $18 an hour for fast food, it's really hard to get someone to want to be out in hot pavement flagging for what we're paying. So we're still working on that, and we'll be talking with our unions to try to see what we can do around bumping that up. Supply shortages continue to be a problem across the organization. In fleet, we're noticing that it gets longer and longer to get our equipment. We've been waiting on our first electric vehicle F-150s for I think over a year, and hopefully they'll come soon. But there's a number that are experiencing long lag times. We're also experiencing on our capital projects with our landfill project and the price escalation, the landfill liner. There was a huge spike in that after we let the contract, and we ended up having to pay another $200,000 to $300,000 for that material. So that's hitting us, as well as labor costs for our contractors and on our internal costs as we negotiate with our labor unions. We just finished with ASME, but we're currently bargaining with our 626 and Admin Pro unions. Increased workload and regulatory work, it just doesn't seem to slow down, and it seems like there's just more and more regulations. I think most of our divisions are experiencing that. And in particular, stormwater. We've had a continuing conversation with the board. We have a new stormwater permit, our NPDES permit, which has a number of requirements with timelines that we have to put a program around in place. And that's going to be a significant cost that we're bearing across different divisions. Land management, here talked about having to add a position, engineering construction services. We are exploring a utility fee as a way of potentially covering that increased expense, and that'll be a continuing conversation with the board. And then finally, grants and other award opportunities. That's both a challenge and an opportunity. With the infrastructure bill, the federal IIJA, there are lots of different programs out there, but we're still trying to figure out how we can tap into that money. What's going to be held at the state, and what sort of projects that we could be competitive in. It takes a lot of time and bandwidth to try to track down the information on those and put grants together, but we don't want to miss opportunities. So, we're engaging with other areas around the county. We have our new policy department, and we're looking to engage with them, and they're already helping us on a few different grants opportunities. So that's exciting to see that there could be money flowing, but it's still kind of we're unsure of how that's going to work out in the coming budget year. That, subject to your questions, that concludes our briefing. Thank you.
Questions? Mr. Dreyer.
Thank you. I had a couple of quick ones. First for Stu, for Gordon. Good to see. Those 100 FTE, is that inclusive of the requested additional positions? And also, are they year-round full-time FTE, or is that an average over the year because of seasonality of work?
No, those are full-time FTE, and they are 101.5 is those included. That will be where we're added if those are accepted positions.
Great, thanks. And then Kier, the plan submittal and tracking and streamlining, what's the estimated timeline for that being in place? And is it going to be sort of full on once it happens, or sort of beta for a smaller slice of the work? How's that going to happen?
Yeah, well, we're currently in the RFQ development process right now. So we've done an RFI. We talked to a number of different vendors, and the timelines vary depending on vendor. Some of them are real aggressive, and they say maybe 6 months. Some seem a little bit more realistic, and it's in 12 to 18 month timeline. But I mean, it's an all hands on deck situation on land management. To try to, so we'll be leaning into it, but a lot of it will be dependent just on the timelines of the vendor and complexity of the system.
Great. And I guess one more question, Dan. I don't know, the public health modernization that we talked about a little bit earlier, I know some of the funds and the programming focus shifts of that will allow, for instance, for some of the air quality work to come under public health. Is there any, do you know of any opportunity for some of the wastewater, stormwater, as in terms of that part of environmental health, potentially working in collaboration with public health through the Modernization Act?
Great question, Commissioner. And I would like to say yes, but from what I've seen so far, we haven't been able to find grant funding for our key stormwater and wastewater projects, unfortunately. So we'll keep exploring and hopefully we'll find something. But there are water and wastewater programs within the Jobs Act, but they're focused in specific areas, you know, for example, addressing lead in drinking water. And so, you know, it's a big area in certain parts of the country, but it's just not what our projects are. So,
okay, thank you.
Committee? Commissioner Carr?
Thanks. Kier, I'm going to telegraph a question that I've got written here. And it's kind of a reiteration of questions that you're often asked in Board of Commissioners meetings, but it's this one's going to be pertaining more to the budgetary impact, and it's regarding challenges, land use challenges. That many of the land use decisions that are made, particularly residential, get challenged, and it protracts the time that the applicant experiences before they have the permit issued. Out of your hands completely, the challenges as they occur. So my question surrounding that is, can you describe the time delay impact on the cost of the project to the applicant? That take a little bit of time on that. You don't need to respond to that right now. And the second part is that a question I've never really asked, but is there an FTE impact made by these challenges? And really that is pertinent to, we look at the FTE numbers, we look at the fact that you are understaffed, you are structurally imbalanced in budget, and how much of that imbalance comes from the fact that we are challenged far more than other counties are.
Yeah, I'd be happy to respond to that. I know that we probably dedicate a full 1.5 FTE per year responding to appeals. So that's a significant cost. We also pay for the hearings official services as a contract. That has been hovering for land use appeals around $80,000 a year, sometimes $100,000. So significant cost right there to land management and county. More critically, though, as you point out, this creates delays and adds costs to residents and applicants. And so if we were to walk through a typical land use process where there's a statutory timeline defined that we have to issue a decision within 180 days for a land use decision, you know, our goal, our target is to try to issue a decision within 70 to 80 days. That's often hampered by the appeal process, and that can add a significant amount of time onto it. Just to work through the local process, it can add 6 weeks easily on. And then if it's appealed further to the Land Use Board of Appeals, the Court of Appeals, we've seen some cases go all the way to the Oregon Supreme Court. And, you know, those folks are hiring a land use attorney generally. Their permit is delayed during that time. Like in the last year, that you're going to see an increase in materials costs skyrocketed. You'll see an increase in contractors, hard to find contractors. So it's been really exacerbated in the last couple of years, the impacts of those delays on that. It's hard to quantify, but it's quite a lot.
Thanks for that quick response. Clearly you think about this a lot. And Ms. Mokrowski and Mr. Hurley, I'd like to tell you that I call Kier often with things that I hear from constituents, and he is so responsive, man. He responds as quickly as possible, gives me the words to pass along to the constituents that don't always ease all of the tension, Kier, but it really helps them to understand the issues that are moving forward. So thank you very much.
And I'll take a quick opportunity to add on the end of that. I think that hampering of good quality respectful development also negatively impacts the county's ability to generate tax revenue by increasing the value of everything in the county. So our taxes are based on the value of those assets, not building new respectful assets in the county further exacerbates the lack of revenue generation for the county. That's I guess more of a statement than a question, but it does actually. Additional questions from the committee? Commissioner Buck.
I have a couple here, but I'll start with Christina. One of them was specifically around parks, because we are getting information about a potential park levy that we've been presented with capital construction costs that are deferred, which are significant. But it sounds like we also don't have enough staff. So is this levy to propose both capital construction and additional operating revenue, or is it just one of each? Does the capital construction portion?
Someone recommend go to the commissioners propose this, I'm sure they'll explain more detail, but this would be for operational and capital, so that'll be the capacity to actually.
I forgot to mention, Joe, I'm going to be walking the shores of Richardson tonight, and I'm excited to see the lake level.
It is basically at 98% now, which is wonderful, but it's slow to get there. And that's the challenge.
Yeah. Additional questions from the committee? Commissioner Bosevich.
Thank you. Just probably for the help of Metro, when you guys answer questions, you might want to move up to the table, particularly here and anyone who has a soft voice. I'm sure that they'll be thankful if you do that. So, you know, it's so much in this division to talk about and ask questions on. I'll just get to the one thing and it's not so much a question as it is I'm going to look into. Almost every public agency that does permitting in the state of Oregon subsidizes that permit function from some other fund. We are not, because we lost our timber funding and we made a decision years ago to put land management on an enterprise basis where they have to make whatever money they spend. And it's caught up to us in so many ways, and in just the staffing levels move up and down with permit levels, and we can't ever seem to keep up. We have too much staff when they fall off and too little staff when they pick up. I am going to look seriously into how we can start subsidizing land management. I've got some questions I'm passing on to staff about use of general fund and video lottery and a few other things, but it's something we have to take on for the long-term health of this county. As our chair noted, constant delay due to lack of staff, constant delay just because we can't get to keeping up with modernization, you know, that's waited so long to take place, cost us in our ability not only to have taxable real market value assets that are, you know, property taxable, but it's really costing us economically in this county in that we can't attract employers because they can't house their employees. I can't tell you how many employers have reported to me they've hired somebody and the person left because they couldn't find housing. And that's from doctors at Peace Health down to restaurant workers on the coast. They can't find housing. And we have to break the permit logjam. And I think we've got to relook at that decision that was made years ago about subsidies for land management. And we have to find some way of doing it.
Oh, Bruce, please.
There we go. Just a quickie, we're talking about road safety, and only because I just got back from Maui a few weeks ago, and you were talking about rumble strips, and I don't know if they're cost effective or not, but they certainly get your attention. Most of the rural roads over there have it, and I just wonder if is that a cost effective solution? Is it does it even make any sense? One of the experts, I just like to know.
Yes, it's very cost effective in saving lives. It's one of the top measures that you can implement in your safety program. So yes, it is a good. The one thing that we run into is the noise. And so we are looking at a different type of rumble strip. It's called a mumble strip. And it's just got a softer sinusoidal system that is supposed to soften that noise. Because for the driver, what you want is that attention. And just that rumbling in your vehicle is a good approach. So yes.
So we've been putting them on more and more into our projects. We tried doing fog strip rumble strips with Marcola Road and got so many complaints on that, so we backed off on that. We're only doing center rumble strips, but excited about the mumble strips and trying that out.
Yeah.
Other questions from the committee? Okay, thank you, Mr. Hurley and team. Thank you very much. Thank you. Okay.
Call it with rumble strips. You live next to those.
Christine, do you want to go ahead and move those forward just so we keep them beyond the mic?
Yeah.
There we go. Thank you.
Yeah.
Excellent. Okay. Emergency management and fire recovery. Go ahead and take it away.
Okay, great. Thank you very much. Good afternoon, Budget Committee. Thank you for your time. I brought with me, my name is Patience Winningham. I'm the emergency manager here at Lane County. I oversee the Office of Emergency Management, and Matt McRae is, I'll let you introduce yourself.
Wildfire recovery manager focused on Holiday Farm Fire.
Great, so we'll get started with my slide deck, and I think slide deck manager is Christine.
In another room.
Oh, in
But
another
she's
room.
listening.
Very good. Thank you very much. So we'll get started with the next slide. So emergency management is really charged with a number of things. And first and foremost, we're primarily responsible for preparing our organization and our staff to respond to disasters, catastrophic disasters such as Holiday Farm Fire and COVID. So I've been here about 3 years and we've tested disasters a couple of times now. So I think we're really hitting a good rhythm here, but it's given us an opportunity to focus on updating our emergency operations plan. So that's really where myself and another staff member spent a lot of time working with our organization and getting our emergency operations plan updated. Other things that we're working on include our community wildfire protection plan update. So about 2020, we got a plan in place, got that updated, and that plan will continue to get updated and revised. And the community wildfire protection plan has a subcommittee that's comprised of many members within the community, and we work together to develop action items and prioritize those action items in fuels reduction projects and leveraging local resources and local efforts so that we're not duplicating energy, but we're focusing together in a more coordinated fashion with all of the players in the room to include Lane County divisions and departments, but also all of our partners out in the community from utilities to fire districts. So we're leveraging those partnerships. And the next bullet hits that building partnerships and collaboration across Lane County, because there are many jurisdictions and entities that have something to provide and support and benefit from emergency management across the board. And that includes all of our city partners, so Bonita, Crestwell, Cottage Grove, Florence, and coordinating efforts with them and emergency planning is important. But there's also other pieces in there that we focus on, and that's mitigation strategies. And I think Mr. Hurley had alluded to mitigation, and one of his funding opportunities or challenges was all these grant dollars that are coming our way and our ability to manage them and know what we can go for, and having the staff capacity to be able to apply for these dollars and make sure that we're getting those or leveraging them in the right places. So in preparedness, it's really training key personnel for critical EOC positions. We have worked with department directors and identified a number of staff across the organization that could fill a role in an emergency operations center activation. And we continue to train with those folks. That my staff have been really working hard on making sure we're getting in front of those people on a monthly basis. And we'll be coming to the board in June with a Cascadia exercise. So I'm looking forward to that. And then also exercising and activating our Emergency Operations Center for a full day. So again, developing a training and exercise plan for every year is something that we're really charged with, and making sure we're playing with our internal staff, but also our external partners, and preparing for that next emergency. And the next thing is recovery, really focusing on what's our recovery into the future. So Matt's really focused on recovery for the Holiday Farm fire, but we also need to have a recovery plan in place that we can lean on for the next disaster. We've been in recovery mode a couple of times now since I've been here. COVID was one of them and Holiday Farm fire was another. However, we don't have a real solid recovery plan in place that we can lean on and use to guide our way. And that's something that I'm really looking forward to getting on the shelf.
Don't forget Snowmageddon.
Oh, yeah.
You almost
I'm
forgot.
trying to forget all those other ones. Yeah. So my program currently is a 5.5 FTE. However, 2.5 FTE are in emergency management, and the other 2 are within the Holiday Farm fire recovery efforts. So next slide. So my program is actually funded by a federal grant, half by a federal grant. It's the Emergency Management Performance Grant, which comes with its own work plan. And there are work plan items or requirements that I have to meet in coordination with my staff, as well as the organization. So having an emergency operations plan in place is one of them. Participating in tabletop exercises and conducting a full-scale exercise on an annual basis is another. Having a mitigation plan is one of them. Having an adopted mitigation plan that's been approved by FEMA and approved by this board, have those in place are all benchmarks that need to be in place in order for us to receive this funding. The funding is also matched with dollars from our departments. They provide the match for that. And then a small indirect administrative cost, my program. The state revenue there we're leveraging is really for the Holiday Farm fire recovery efforts specifically. So that's really what's generating and supporting Matt's work. The MWAP, the Municipal Wildfire Program, as well as the property tax revenue is funding some other staff within that effort. Next slide. So again, personnel is 5.5 FTE. You'll see there personnel services is pretty bloated. It's going to show that because we're also recognizing the funds that are being brought in for Holiday Farm fire recovery efforts. So even though the fire is over and the fire is out, we're still collecting dollars from the response. We still haven't finished collecting the dollars from that effort, but we're also working on bringing in additional grant funds, hazard mitigation grant. We have a couple projects out that are applications that we're waiting to hear back on that hopefully will get funding in the next year and fund some of these efforts. But then the materials and supplies, again, it's going to look a little bit different across the board because we're also holding the Holiday Farm fire recovery efforts in our program. Next slide. So again, this delineates what the emergency management program structure looks like. It includes the 4.5 FTE and the 2.5 for my program, with an addition of a 1.0 limited duration coming on into the future. So next year, that's our ask, is adding in a position to help with a couple of things that I'll bring up here in a moment. But the continued support for COVID-19 and Holiday Farm fire response and recovery efforts continues to show some wonkiness in my budget, so it won't really show flat for a little while until we get through some of these additional grant funds and recovering expenses that we incurred for the Holiday Farm fire. And then my efforts are really, again, around that continuous update of our emergency operations plan, developing training plans for our organization, but also helping our partners within the community and their efforts, and building those relationships across the board. Next slide. So the Holiday Farm fire continues to result in those variations, and we'll see that over the course of the next couple of years. In the budget documentation, you'll notice there is another addition of disaster housing program staff, but that's actually since moved back to Health and Human Services, so that'll be a little bit of an adjustment or change in some of the narrative that you have. Next slide. So aligning with the county strategic plan, we called out a few things here, specifically safe and healthy counties. It's develop an interface and integration between the natural hazard mitigation plan and climate action plan. There is some movement at the federal level that requires that, adapting climate adaptation and integration into our natural hazard mitigation plan. I actually have not gotten to participate in that yet, but working with Mark Nystrom's shop and trying to figure out how that's going to align. Our mitigation plan will undergo its 5-year update starting this summer. That's a 1-year monumental lift, and why I'm asking for an additional add to our program to focus on the development and update of our mitigation plan that includes all of our city partners. So Florence, Westford, Oak Ridge, not Cottage Grove, Junction City, but there are a number of them that are annexed into that mitigation plan, and it really looks through each of those jurisdictions' hazards and identifies action items that could be taken in order to mitigate risk to them into the future. Again, the vibrant communities, building relationships and planning training and exercise with our rural partners is extremely important to me, and bringing in the fire districts and law enforcement partners to be sure that we're all prepared for the next wildfire and also prepared for the next disaster. Focusing on Cascadia is extremely important. And then standardizing our emergency operations plan to align with federal guidance. The national preparedness goal and the national response framework has been updated in 2019. I'd imagine it's going to come with another update here shortly. And we need to be sure that we're directing staff and training to the same levels at the federal and the state level, so that when we're all in the same room, we're speaking to the same sheet of music. My goal here would be the next bullet here: establish a policy and procedures to identify disaster cost recovery policy and procedure, because in Holiday Farm Fire and COVID, it's hard to get those funds reimbursed from FEMA. It's not an easy task, for lack of a better way of saying that. It's a monumental lift, and being able to have a cost recovery plan for the entire organization that can help inform their way ahead and how do we seek reimbursement in these expenses is extremely important. And I'd like to see us get something in place to help inform us for the future when we're seeking public assistance reimbursement through FEMA. And then securing the hazard mitigation grant funding. Matt and I have put in hazard mitigation applications for 2 very large projects, and we're just waiting to hear back that we get funded for those. Matt's project is $2.2 million and mine's about $750,000, and that could also be something we're focusing on over the course of the next year or two with those dollars. And I can speak to both of those if the board is interested in learning about those projects. Next up is conduct training in staff for incident command system and EOC. We were approved to do a integrated emergency management course back in Emmitsburg. So this is something that we have to apply for, and FEMA looks at our application and tells us if we're a viable community that could benefit from the opportunity. And we got word a couple of weeks ago that we were approved to take a number of staff back to Emmitsburg and work through a simulated environment in an emergency operations center. So I'm really looking forward to watching that move forward and progress up into November. So we did get some dates there. Looking forward. I am currently the chair of Lane Preparedness Coalition. Lane Preparedness Coalition is really comprised of private sector, public agency representatives, and we provide a quarterly training to them to really help drive home emergency preparedness activities. We talk about lessons learned, but we also talk about ways that they can prepare themselves and their organizations. It doesn't get a lot of traction because not a lot of people know about it, but it does exist, and I'm currently the chair and hoping that we can get some more life into that. COED is another one of those examples that not a lot of people know that it exists, but working to figure out how to find how to get more people to come to the table and participate in those groups that already exist within our community. It's extremely important. Next slide. So again, the key initiatives for me next year, number 1 is the update to our natural hazard mitigation plan. Now, I don't want to say that this is an easy lift because it's about 800 pages. So it's going to be a little bit of a lift. And the goal this time around would be to not only include our partner cities, but also work with our special districts and include some of those smaller water districts that are eligible to apply for hazard mitigation grant funds if they were added into our plan. So up until this time, they have not been a part of our plan, and the goal is to get them written in plan to include water districts and our utilities and our fire districts and our school districts. All special districts are eligible so long as they're written into our plan, and that includes BRIC funding. So that's a hurdle that we're going to need to overcome over this next year. I do anticipate we'll be coming to the board next July to adopt that plan and move it forward for FEMA adoption. Just to give you an idea on timing. The other key initiative here is, again, that those work plans for EMPG is required. Having those 3 exercises, 3 tabletops and a full scale, meeting the work plan requirements of EMPG, and then developing a recovery plan. Next slide. So measuring performance, I think I pretty much gave you that, but the training and exercise is huge. Having those three exercises, having our emergency plan in place that are outlined really specifically by that emergency management performance grant that are set in place by the state. The implementation of national qualification system is another federal requirement that's going to be coming our way and most likely will be implemented next year, but they're starting at the state level of implementing a pilot group that will work through what that looks like for us at the local level and how we'll integrate that into our training and our emergency operations center overall. Updating those mitigation plans and updating our capabilities assessments. So annually we go around and talk to all of our community partners and we talk about target capabilities in a Cascadia scenario. So how many people can we house in a Cascadia scenario? How long can we sustain without power given the population we have? These are some of the questions that we get asked, and we have to be able to answer those, and continuing to drive into those and see every year we can tick off some of these things that we can and can't do and better understand what our risks are and what our capabilities are to inform the federal government and our state partners. Next slide. So future challenges, there's a couple of things here that I think are important to call out specifically, and that's the continued alignment with our emergency operations plan and the federal guidance. My program, again, is 2.5 FTE in emergency management that continues to look forward, and being able to lean in on that federal guidance and stay up on what all the requirements are, making sure we're incorporating those into our plan updates and doing that in a very methodical way. Again, the NQS system and the implementation here at the local level, that will be tied to federal funding. Like we will need to have these things in place in order to move forward and receive these federal dollars, which is extremely important, but also beneficial for our organization because it's going to give us a roadmap. And then utilize these recent events, so COVID and holiday farm fire, to develop that disaster recovery cost plan. I think is extremely important, as well as a disaster recovery plan, something that I'd like to focus on over the course of the next year or two. The other challenge that I would say, it's an opportunity, but it's also a challenge. Oregon Emergency Management has been redirected, as of July 1 will become a department of itself. So it'll move outside of the Oregon Military Department. They are doubling in size, which adds a little bit more weight at the top, but still a little less at the bottom. And then Oregon State Fire Marshal's office is doing the same thing. They also are getting more staff, and I'll be coming to the board in a couple of weeks to introduce you to some of those staff that they have at Oregon State Fire Marshal's office. But it's more resources at the state is a little bit challenging for us emergency managers at the local level. We're not the only county with limited staff and emergency management programs, so we're all working together collaboratively to kind of hold the state at bay when they ask us to do things that we can't humanly possibly do with what we have. So I think we're in a really good place to be able to do that and just kind of keep them in a good place at the state and federal level to let them know that, hey, remember, we're really small shops and we're doing the best we can to keep up with you. So. But with that, those are all my notes, and I'll open it up for questions, if any.
Questions from the committee? Ms. Osler.
I have a question about, while it is very understandable the emphasis on fire preparedness and fire readiness and the aftermath of the Holiday Farm fire, I'm wondering about how much analysis or attention is being paid to fire risk in the Coast Range, the western part of the county. It's not, I'm not hearing it from folks out there that they're aware of much attention being paid to that issue, but 13 years into a drought, of course, they're quite vulnerable. So just curious how you see
the county's efforts on the west side of the county on fire. Sure. Oh, there's many players in the room. So first responders are working on evacuation and training and exercise. I participated in an evacuation exercise in one of the smaller communities in the unincorporated area with Sayusula Valley Fire a month or two ago. That's just peeling back the onion one layer at a time. We also went out a couple weeks ago and utilized our emergency alerting capability tools in coordination with dispatch, law enforcement, and fire, and to see where it worked and where it didn't. And there's a clear process from who asks to push the button, and then who pushes the button, and then who gets the alert, right? And then what's the message on the other side? So we're continuing to try to, from a response component, look at it from that piece. Mitigation, the Community Wildfire Protection Plan is another tool that we're utilizing to identify risk across Lane County. And the plan actually has broken the county into eco-regions, and that's looking at the Cascades, the Valley, and the coast. And the vegetation in any one of those areas is very different. And the fuels reduction and the re-veg after a burn are completely different depending on where you stand. And so that's the work of the CWPP subcommittee, and focusing those efforts on how can we do this better and leverage resources and coordination. And that's my project that I submitted for hazard mitigation grant funds, was to leverage getting all those partners together and providing more information to the homeowner, the property owner, or the residents in all things emergency management in wildfire, from response to mitigation to recovery to vegetation and the like. So we're working on it.
Mr. Trigger.
Thanks so much. So appreciate your work. I'm hearing a lot about working across jurisdictions, special districts, cities, and I mean, we just sort of have to consider that part of our capacity, even though it's not ours directly. Even though there's some, there's clearly overlay of effort, but there's distinctions and differences that those jurisdictions simply can't do that we have to do at the county level. And you talk about 2.5 FTE for a county of our size, geographically, our population, variety of landscapes. Do you have a number of FTE you would consider adequate? How under resourced are we for what's in front of us?
I don't have a number. I don't actually have a number. I have enough to keep me out of trouble right now for work, if that's fair. I tread lightly in my asks because you also have to manage them, right? And the emergency operations plan was really my first thing to tackle, and we've almost got that in a really good place where we're going to start testing and training and exercising our emergency support functions, and that's where we'll bring in our community partners and start helping them better understand where they fit into the bigger picture. I think will be a monumental task, but achievable. The other piece of that pie is the mitigation plan will be the next place where we focus our effort. And my ask was the addition of that limited duration mitigation and recovery position, because that position can help me tick off those two things, the updated mitigation plan, but also the development of that recovery plan. And then you'll notice that Matt has the 1.0 limited duration finance and admin person. That's really helping him get more reins around holiday farm fire expenses and recovery, but also my opportunity to get them trained up in alphabet soup of emergency management funds, so that we can have a more solid tool within our organization to inform our community, our departments. So all of our departments all talked about the access to the mitigation, BRIC, and all these other federal dollars, and having that person be a little bit more tooled up would be super helpful. So treading lightly.
Great, and that was my other question, the BRIC funding. By putting these special districts and other jurisdictions into our overarching plan, that is what makes them eligible, but they would still be the ones applying directly.
That's correct.
Thank you.
That's correct.
Mr. Bosich.
Thank you. So I just want to say how glad I am to hear about everything your department's doing. When I became a commissioner, we basically had less than one FTE doing emergency management in the sheriff's office. And I made it a point of my first year as chair to work on resiliency in our emergency response, and it kind of set in motion creating your position and department in the long run, and the training that got spread more broadly across our organization. Very little of our organization even knew what an incident command system was, let alone, what logistics or planning section did or had any idea. And actually got the board to go through some incident command training just so they could understand what it was. So I'm really happy to hear about the work we're doing and the fact that now we're actually updating a plan that we drafted for the first time ever. 5 years ago, we never had a natural hazards mitigation plan. So I just want to appreciate all the great work you're doing there. And I'll just, as a sort of an aside, the Western Lane Fire Protection Association deals with protecting fire at the Coast Range in Lane County. And it's a cooperation between ODF and Oregon Department of Forestry, the private property owners and BLM all working together out there in that checkerboard that is the ONC forest out there. Some of the unfortunate part, though, is the ONC forest is being harvested at less than 10% of its growth rate, which means it's a problem that's just getting worse. One of the things we're working on this natural hazards mitigation plan. One of the places I got introduced into a lot of emergency planning was actually man-made hazards, because I kind of had to live through all the critical infrastructure assessment work after 9/11 when I was at EWEB and trying to figure out how we're going to protect our reservoirs, how are we going to, make our control systems, proof from being hacked and used for nefarious purposes, or even held by ransomware. So as we're looking at the natural hazard mitigation plan, is there any work on man-made hazards? And technically, if you even look at the Labor Day fires, most of them were caused by failures in man-made infrastructure were the ignition points. So yeah, it's can you kind of address the man-made side of your?
Sure. Yeah, there's lots of moving parts around the man-made. So there's three parts, right? There's natural, human caused, and technological. The human caused, you're spot on in that, yes, there are lots of moving parts about the ignitions for fire. We did have a fire bug last year that was starting fires, and we need to better understand what that looks like and how do we work together in those partner agencies and what's our plan. The other piece of that is the technological and the critical infrastructure component. There is a new group at the federal level we call CISA, the Cybersecurity and Infrastructure Group, and we have an appointed state liaison for the federal government that has come to us and worked with us on a couple of different things, specifically for special events lately, which would be Worlds and the fairgrounds, in doing critical infrastructure assessments, security assessments. What is our vulnerability and risks at these locations because of these high populated events? But the other piece of that is looking at our cybersecurity and supporting some of our TS work that we're doing a cyber plan, and then tabletopping or exercising that cyber plan is extremely important, and that work is also happening. That's being funded by a Homeland Security grant through my office, which is huge. And then the next piece is the RRAP. So there's that Regional Resilience Assessment Program out of the governor's office that Mike Harriman is working on, and they're coming and looking at our infrastructure and assessing its ability to support us in a Cascadia scenario. And it's kind of opening that lens of how long till we could restore power. Where could we expect power to be compromised? When could the airport be operational, and what can we put there? And all those conversations are happening now, and they're slowly starting to pull in locals. So it's happening at the federal and state level, and they're starting to pull us in as they pass each of the components. So the first one was the airport assessments, which is done, and now they're working on the technology components. When we look at cybersecurity and the fiber lines and what they're interdependent on, and one cut and you're done here or done there. So they're doing all that work now. So it is working, and at some point we'll get pulled into that.
Thanks.
Yeah.
Commissioner Park.
Thank you, Chair. I had a few more questions, but I'll not ask them. We're certainly running a little bit short on time. I just wanted to say this, Matt, this is the first time we've had a chance to really sit across the table face to face. You, for the last 2 years, you've been presenting outstanding, up to the minute reports on the holiday farm fire. You've given information, you've given answers to questions that we're all able to pass along. This is an opportunity to say thank you for face to face for the work that you've done over the last 2 years. It's hard to say that on a Zoom meeting, but thank you, sir.
I appreciate that. Thank you.
Other questions? Okay, thank you very much.
Yeah, thank you.
I was watching first. So you didn't say anything.
Yeah.
Okay, that brings us to committee business, and I think it's appropriate to bring up at this point in time that we have some flex time that's available in the next meeting on Thursday. And so when I was talking with budget staff before we started the budget season here, we talked specifically about this meeting, and because of the altered format that we're going through, we thought it was appropriate to hold some time in case the committee as a group decided that it needed to do a deep dive into an area that we've either partially touched or that we haven't touched on. So we do have time available in our budget schedule at the next meeting if the committee finds that there's a gap that we should be filling. So as you know, part of this session today, we should highlight if there's something there we want to talk about or anything else. So Christine, anything else to add from staff before we open our discussion here?
No, I think you covered it, just that we would like to know today. So
Absolutely,
yeah. Yes. Yes.
The one thing I would say is you have on your schedule a 15-minute presentation from the assessor on revenue and property tax. I think we'd like a lot more time. There's plenty of time on Thursday for that. We were thinking maybe 30 minutes.
Sure.
And it's certainly possible the ARPA time won't take all 45. So you have some flexibility on Thursday. And as you mentioned, Chair, if there are any particular areas you'd like to dive more into, yeah, it'd be great to hear that right now. So we can prepare.
Yeah, we should do that as a committee. If there's something we want to talk about on Thursday, like Commissioner Mosevich.
Depending on the answers to some of my questions about general fund and video lottery dollars, a deeper discussion of long-term financing and subsidy of land management would be something I would like to talk about.
What kind of resources we need to have at the Thursday meeting to cover that?
Probably mostly, Christine, and if I'm going to divert from H&HS, I'll let her know the divisions I'm thinking of, so they might be able to be here. But it'll depend on what I get back from the questions I asked, which was specifically, I wanted a full description of the general fund or dollars that go into H&HS. And then, we got a little bit of a description of part of it today going into public health, but I want a little bit more detail around that. And then I also want to get an understanding of what our projected video lottery funding is, where it's being spent now, what are the restrictions around that, because I believe building permits might be an eligible use of that money, but I want to know what I'm taking from. So, who we need in here resource-wise depends on the answers to some of those questions. But I think we seriously need to talk about some kind of long-term strategy to shore up land management's funding structure. And speaking of assessment taxation, one of the gaps we have is things get permitted, built, and then don't get assessed because we don't have a clear way to go from a use and occupancy to assessment for taxation. There is no connection between those two systems right now. No easy connection. So we could really be changing some of our revenue structure if we had some resources to fix some of that. So that's kind of why I'm a little bit focused on this area. I just think it's a place that as a budget committee and making some budgetary changes could make a big change in the long-term projection of the department that is being reported as being 2.8 million upside down probably if we don't do anything. And it's going to be subsidized by the general fund anyway, because where we're going to close that with general fund reserves probably. So that's just a longer term discussion. I think we can start this year. It may not get fully resolved this year, but we might start thinking about strategies around how do we fund LMD long term, because we can't charge enough on a permit, on especially some of the land use permits that won't grind our development in this county to a halt by the expense side if we're going to fully recover from it. So that's kind of where I'm thinking, but that's highly dependent on some of the answers to some of those background questions.
Christine?
Maybe to help on the general fund and in general for the committee to remember maybe because the general fund is balanced and as you know, not structurally balanced, but you have the SOS forms that do give you the detail of every discretionary general fund dollar. So you can go on the summary, like if you're looking at H&HS, you can see exactly what their programs are, and they've done their best to describe the service being provided and how much general fund is in that service. So hopefully that helps you on that piece, Commissioner, but we can dig into it deeper once you see the service areas. So it goes in more detail than just saying public health. Where it says, you know, a specific service. And the video lottery questions, I can get back to you pretty quickly.
Okay.
And I know that there was a board order, there is some video lottery that goes into land management now to pay for a planner.
That's what I thought.
So we can pull that information for you from when that analysis went to the board. It would probably be the fastest thing that I could pull for.
Yeah, I remember some restriction about no more than 50% can be spent on county funds or something. I just don't remember. It's been a while since I've addressed video lottery dollars, so I can't remember the wording of the statute around.
So that's actually a lane manual. That's a board of commissioners rule that says you will strive to spend no more than 50% internal to the county. And so we do track that. I actually haven't done the calculation for this close, but I could do it pretty quickly to make sure we're below the 50 and what would get us to the 50%.
So that may be a recommendation to have a change of policy if it looks like we're going to go over the 50. Yeah. Okay.
So maybe I have some on that specifically.
Yeah, let's hold that one there. Any other topics from committee members that kind of this idea of the gap for things we're not getting out of the process we've had so far with the committees? Okay. Christine, you and I can talk about that one a little bit, maybe after you looked at all the options. Okay. Other committee business, other topics? Okay. We're back in here on Thursday in the same room. Is it 2 o'clock again?
Yes.
Okay.
We did, just maybe to mention, we did get an email last night with the minutes from May 3rd. So the plan would be to approve those on the 12th, and then you'll be getting more. The goal is to get them all to you at enough time that you can approve them on the last night, except for that last night, of course, which will be next year.
Excellent. And I think we should go ahead and try to plan to have the Zoom option available.
For Thursday?
For Thursday?
Yes.
With Mr. Hazen still being out, we should probably consider that as well. And use it as we need. Anything else from the committee members? Okay, meeting adjourned. Thank you all. Thank you.